Why are you interested in working in the perioperative setting? What aspects of the OR environment appeal to you?
I am deeply interested in working in the perioperative setting because it allows me to be a part of one of the most critical and dynamic areas of patient care. Ever since my clinical rotations, I've been drawn to the precision, coordination, and high standards of safety that define the operating room. What appeals to me most about the OR environment is the sense of teamwork and trust that exists between the surgical team members. It's a space where everyone's role is vital, and clear communication and attention to detail can make a significant difference in patient outcomes. As a nurse, I find great purpose in being able to advocate for patients when they are at their most vulnerable, under anesthesia and unable to speak for themselves. In the perioperative setting, that advocacy becomes even more profound. I'm particularly drawn to the structured nature of the environment, where protocols are strictly followed, yet critical thinking and adaptability remain essential. I also appreciate the opportunity to contribute to infection control and patient safety at such a high level, as it directly aligns with my commitment to quality care and evidence-based practice. Overall, the perioperative setting offers a blend of technical skill, compassion, and collaboration that truly resonates with my professional values. I see it not just as a workplace, but as a platform where I can continue to grow, learn advanced techniques, and be part of a team that makes a real impact every day.
Tell me about your nursing experience. Do you have any previous OR experience? If so, describe it.
Throughout my nursing career, I have had the opportunity to gain experience across various clinical settings, which has helped me develop a strong foundation in patient-centered care, critical thinking, and effective communication. I began my practice in a busy tertiary care hospital, where I worked in both medical and surgical wards. During that time, I developed a deep interest in perioperative nursing, which led me to actively pursue training and hands-on exposure in the operating room. Yes, I do have previous OR experience. I spent over a year working as a scrub and circulating nurse in a multidisciplinary operating theater. I was involved in a wide range of procedures, including general surgery, orthopedics, ENT, and gynecological cases. My responsibilities included preparing and maintaining the sterile field, assisting surgeons with instrumentation, ensuring accurate surgical counts, and monitoring patient safety throughout the procedure. As a circulating nurse, I played a key role in supporting the surgical team, coordinating with anesthetists, and advocating for the patient's needs during surgery. This experience not only enhanced my technical skills and knowledge of surgical procedures, but also strengthened my ability to remain calm under pressure and respond quickly to changes. I learned the importance of seamless teamwork, vigilance, and adhering strictly to infection control protocols. It also deepened my passion for perioperative nursing, reinforcing my desire to specialize in this area and contribute meaningfully to patient safety and recovery. I'm now seeking to bring that experience into a more advanced and structured international setting, where I can continue to grow professionally and deliver high-quality care as part of a multidisciplinary surgical team.
What are your strengths that you feel would be particularly valuable in the OR? E.g., attention to detail, ability to remain calm under pressure, teamwork.
One of my key strengths that I believe is particularly valuable in the operating room is my ability to remain calm and focused under pressure. The OR is a high-stakes environment where situations can change rapidly, and I've learned through experience how to maintain composure, prioritize tasks efficiently, and respond quickly without compromising patient safety. This calmness allows me to think clearly and support the surgical team effectively, even during complex or unexpected situations. Another strength is my strong attention to detail. Whether it's surgical counts, maintaining sterility, or anticipating the needs of the surgeon, being meticulous is crucial in the perioperative setting. I take pride in ensuring that every step, from preparation to post-op handover, is done with accuracy and consistency. This contributes not only to patient safety but also to the overall efficiency and flow of the surgical procedure. I also bring strong communication and teamwork skills. The OR thrives on clear, respectful, and timely communication among all team members. I make a conscious effort to foster positive working relationships, listen actively, and support others, whether I'm in the scrub or circulating role. I believe that mutual respect and collaboration are essential for a smooth and successful procedure. Lastly, I'm committed to continuous learning and professional development. I actively seek opportunities to expand my knowledge of new surgical techniques, instruments, and evidence-based practices. This commitment helps me stay current and adaptable in a constantly evolving environment like the OR. These strengths, calmness under pressure, attention to detail, effective communication, and a dedication to growth, are what I would bring to any operating room team.
What are your weaknesses, and how do you actively work to improve them in a surgical setting?
One area I've identified as a weakness is that I can sometimes be overly self-critical, especially when I'm reflecting on my performance after a case. In the surgical setting, where precision and excellence are non-negotiable, I tend to hold myself to very high standards. While this pushes me to do my best, it can also lead to unnecessary stress or second-guessing, even when I've done everything correctly. To address this, I've learned to balance self-reflection with self-compassion. I now focus on constructive evaluation, asking myself what went well, what could be improved, and how I can use each experience as a learning opportunity without being too hard on myself. I also welcome feedback from senior colleagues and mentors, which helps me gain perspective and stay grounded in facts rather than assumptions. Another challenge I faced earlier in my perioperative experience was becoming too task-focused, especially during fast-paced surgeries. I would concentrate so much on completing my role efficiently, whether preparing instruments or managing the sterile field, that I occasionally missed subtle cues from the surgical team or opportunities to anticipate needs more proactively. To improve this, I've made a conscious effort to enhance my situational awareness and communication. I now take a more holistic view of the procedure, staying attuned to verbal and nonverbal cues, and regularly checking in with the team to ensure we're all in sync. By being mindful of these areas and actively working on them, I've grown more confident, balanced, and effective in the OR. I believe acknowledging weaknesses and turning them into growth points is a vital part of becoming a safe and dependable perioperative nurse.
How do you handle the fast-paced and sometimes high-stress environment of the OR?
Handling the fast-paced and high-stress environment of the OR requires a combination of mental preparedness, effective communication, and strong foundational skills, and this is something I've developed through both experience and intentional practice. First and foremost, I rely on thorough preparation. Before every case, I make sure I understand the procedure, the specific needs of the surgical team, and any patient-related considerations. This helps me anticipate potential challenges and feel confident in my role. I've found that when I'm well prepared, I'm more adaptable and calm, even when unexpected situations arise. In the moment, I focus on staying grounded by using structured routines, such as standardized surgical checklists, timeouts, and proper equipment checks. These routines not only ensure safety but also help me stay organized and maintain control even when the pace accelerates. I also pay close attention to my breathing and body language, simple techniques that help me stay physically relaxed and mentally sharp. Teamwork is another key factor. I believe that a well-coordinated team is the backbone of managing pressure in the OR. I make it a priority to communicate clearly and respectfully with colleagues, listen actively, and offer support when needed. Knowing that we can rely on each other helps reduce stress and keeps the focus on the patient. Lastly, I reflect after high-intensity cases to evaluate what went well and where improvements can be made. This reflection keeps me growing and better prepared for the next challenge. Overall, my approach is centered on preparation, composure, collaboration, and continuous learning, all of which help me thrive in the high-stakes environment of the operating room.
Where do you see your career in perioperative nursing progressing in the next 5 years?
In the next 5 years, I see my career in perioperative nursing evolving in both depth and leadership. My immediate goal is to continue building a strong foundation of clinical expertise, mastering a wider range of surgical specialties, and refining my skills as both a scrub and circulating nurse. I want to become a dependable and versatile member of the surgical team, someone who can confidently handle complex procedures and contribute meaningfully to patient safety and team efficiency. Beyond clinical growth, I'm also interested in taking on additional responsibilities such as precepting new nurses or being involved in quality improvement initiatives within the perioperative department. I believe that mentoring and education are essential for building strong teams, and I would value the opportunity to support and guide others as they develop their skills in the OR. Longer term, I envision stepping into a leadership or educator role, perhaps as a clinical nurse educator or perioperative coordinator. I'm passionate about maintaining high standards of care and would like to be part of shaping best practices, implementing evidence-based protocols, and helping foster a culture of continuous improvement. Additionally, I'm interested in pursuing further education or certifications relevant to perioperative nursing, such as CNR, to deepen my knowledge and contribute at a more advanced level. Ultimately, my goal is to grow into a role where I can have a broader impact, not only at the bedside but also in supporting the development of others and enhancing the overall quality of surgical care.
What motivates you as a perioperative nurse?
What motivates me most as a perioperative nurse is the knowledge that I play a critical role in a patient's journey during one of their most vulnerable moments. Surgery can be a daunting and emotional experience for patients and their families, and being the one to ensure safety, advocate for their needs, and support a smooth, successful procedure is something I find incredibly meaningful. I'm driven by the high standards of precision, teamwork, and accountability that define the OR. Every action taken in the operating room has a direct impact on patient outcomes, and that sense of responsibility pushes me to be meticulous, prepared, and focused at all times. I take pride in the behind-the-scenes work that often goes unnoticed, whether it's setting up the sterile field, anticipating the surgeon's needs, or double-checking equipment, because I know it contributes to a safe and efficient procedure. The constant learning and advancement in surgical techniques also inspire me. I'm motivated by the opportunity to stay current, gain new competencies, and grow both technically and professionally. Each case presents a new challenge, and I genuinely enjoy the dynamic, fast-paced environment where no 2 days are ever the same. Most of all, I'm motivated by the impact we have as a team. Knowing that I am part of a coordinated effort that restores health, relieves pain, or saves lives gives me a strong sense of purpose. It's a privilege to be trusted with that responsibility, and that trust is what fuels my commitment to excellence in perioperative care every single day.
Why are you interested in working at our specific surgical department/hospital? What do you know about our OR?
I'm particularly interested in working at your surgical department because of its strong reputation for excellence in patient care, innovative surgical practices, and commitment to staff development. From my research and what I've heard from professionals in the field, your hospital is known not only for its advanced technology and high surgical standards, but also for fostering a supportive and collaborative work environment, qualities that align closely with my own professional values. What really stood out to me about your OR is the emphasis on multidisciplinary teamwork and evidence-based practice. I understand that your surgical team follows strict protocols for patient safety and infection control, and that there's a culture of continuous learning and quality improvement. These are aspects I truly value, as I believe they are the foundation of a strong perioperative environment. I was also impressed by your hospital's involvement in training programs and mentorship for perioperative staff, which shows a genuine investment in growing and empowering nurses. Additionally, your department's range of specialties and volume of complex cases present an incredible opportunity for professional growth. I'm excited about the prospect of contributing to a team that is known for both clinical excellence and compassion. Working in such a high-performing OR would not only challenge me to refine my skills further, but also allow me to be part of a team where patient outcomes and staff development are equally prioritized. Ultimately, I see your surgical department as a place where I can contribute meaningfully, continue to grow, and be part of a team that truly makes a difference every day.
Describe your understanding of the roles and responsibilities within the surgical team: surgeon, anesthesiologist, scrub nurse, circulating nurse.
My understanding of the surgical team is that it functions as a coordinated, multidisciplinary unit where each member plays a distinct and vital role in ensuring the safety and success of surgical procedures. Clear communication, mutual respect, and a shared commitment to patient care are at the heart of this collaboration. At the center of the team is the surgeon, who performs the procedure and is ultimately responsible for the patient's surgical outcome. The surgeon relies on the assistant surgeon or surgical assistant for technical support, such as retraction, suction, suturing, and other hands-on tasks that facilitate the surgery. The anesthesiologist or nurse anesthetist plays a critical role in assessing the patient preoperatively, administering anesthesia, and monitoring vital signs throughout the procedure to ensure the patient remains stable and comfortable. As a perioperative nurse, I may function as either a scrub nurse or a circulating nurse. The scrub nurse maintains the sterile field, prepares and handles surgical instruments, and works in close collaboration with the surgeon during the procedure, anticipating needs and ensuring sterile technique is upheld at all times. On the other hand, the circulating nurse manages the overall environment of the OR. This role involves preparing the patient for surgery, performing safety checks, documenting the procedure, coordinating with other departments, and advocating for the patient throughout the perioperative process. There may also be technicians, such as operating department practitioners or surgical technologists, who assist with equipment setup, sterilization, and supporting both nursing and surgical staff. Together, the team shares a common goal: delivering safe, effective, and compassionate care. Each role complements the others, and successful outcomes depend on trust, vigilance, and seamless coordination throughout every stage of the procedure.
Explain the principles of surgical asepsis and how you maintain a sterile field.
Surgical asepsis is the foundation of infection prevention in the operating room. It refers to the complete absence of microorganisms and is essential in preventing surgical site infections and ensuring patient safety. The key principles of surgical asepsis are based on maintaining sterility, avoiding contamination, and practicing constant vigilance throughout the procedure. To maintain a sterile field, I adhere to several critical practices. Firstly, only sterile items may come into contact with the sterile field. Before a procedure begins, I carefully inspect all sterile packs, instrument trays, and equipment for integrity, expiration dates, and proper indicators. I open sterile supplies in a way that prevents contamination, ensuring the contents remain within the sterile zone. Secondly, I make sure to always stay within the boundaries of the sterile field. As a scrub nurse, this means keeping my hands and instruments above waist level, facing the sterile field, and avoiding any unnecessary movement that could cause contamination. I remain mindful of my own positioning as well as the positioning of others in the room. Another key principle is that if sterility is in doubt, it is considered contaminated. I never hesitate to replace an item or reset the field if there's any uncertainty. Maintaining the integrity of the sterile field is far more important than saving time or supplies. Contamination through contact or airborne transmission is also a major concern. I ensure that non-sterile team members maintain a safe distance, and I avoid turning my back on the sterile field or reaching over it unnecessarily. Proper mask wearing, controlled traffic in and out of the OR, and ensuring that all personnel follow sterile technique are also part of upholding these standards. As a circulating nurse, I support the sterile team by providing supplies and assistance without compromising sterility, handling documentation, and ensuring all protocols are followed. Overall, maintaining a sterile field is not just about technical skill, it's a mindset of constant awareness, accountability, and respect for the patient's safety. Every action I take in the OR reflects that commitment to surgical asepsis.
Discuss your experience with surgical instrumentation and equipment.
Throughout my perioperative nursing experience, I have gained hands-on expertise with a wide range of surgical instruments and equipment, which has helped me develop a deep understanding of their functions, handling, and maintenance. As a scrub nurse, I've worked extensively with surgical instrumentation, both in routine and specialized surgeries, which has given me the confidence to ensure that all instruments are prepared, organized, and used properly during procedures. I am familiar with the various types of surgical instruments, such as scalpels, scissors, forceps, needle holders, and retractors, as well as more specialized tools depending on the procedure. I understand the importance of knowing the function and proper handling of each instrument, as improper use or contamination can compromise both patient safety and the success of the surgery. For instance, I ensure that I am familiar with the setup and instruments specific to different specialties, such as orthopedic, general, and cardiovascular surgery, adapting quickly to any changes in surgical needs. I have also worked with electrosurgical units, ESUs, surgical drapes, and suction devices. I know how to troubleshoot equipment issues when they arise, and I am comfortable coordinating with the OR team to ensure that all equipment is functioning properly before and during the procedure. This includes ensuring that monitors, lights, and anesthesia machines are calibrated and maintained according to safety standards. I'm also well versed in sterilization protocols and ensure that instruments are properly cleaned and sterilized post-operation, following hospital procedures to reduce the risk of infection. In addition to knowing how to handle and organize instruments, I have experience in counting instruments, sponges, and needles with a meticulous attention to detail, ensuring that nothing is left behind in the patient or the surgical field. This is a critical part of my role, as I understand that an inaccurate count could result in serious consequences. Overall, my experience with surgical instrumentation and equipment has taught me the importance of being proactive, detail-oriented, and always prepared. I strive to stay current with best practices for instrument handling and maintenance, and I take pride in my ability to contribute to a smooth and safe surgical process.
How do you prepare a patient physically and emotionally for surgery in the preoperative phase?
Preparing a patient physically and emotionally for surgery is a crucial part of the perioperative nursing role. It's important to approach both aspects with empathy, clear communication, and a structured process to ensure the patient feels informed, safe, and supported as they approach their procedure. Physically, the first step in preparation is ensuring the patient is ready for the surgery in terms of their health and hygiene. This includes confirming that all preoperative assessments, such as laboratory tests, imaging, and consultations with other healthcare professionals, have been completed and reviewed. I would verify that the patient has followed all instructions regarding fasting, medication adjustments, and any other pre-surgical requirements. Ensuring the patient is properly hydrated and prepared for anesthesia is also a priority. I would then ensure that the patient is properly positioned and prepped for the procedure. This includes providing a sterile gown and applying appropriate monitoring devices, such as blood pressure cuffs, for lines, and pulse oximeters, depending on the surgery. I would ensure that the patient is comfortable, adjusting positioning as needed, and make sure the surgical site is marked according to hospital protocols. If necessary, I would also verify and assist in any preoperative treatments, such as administering prophylactic antibiotics to prevent infection. Emotionally, preparing a patient for surgery requires sensitivity and the ability to reduce anxiety. I start by introducing myself and explaining my role in the process, which helps the patient feel more at ease. I would then clearly explain what will happen in the operating room, what sensations they might experience, and the role of the surgical and anesthesia teams, helping to dispel any misconceptions or fears. I aim to ensure the patient understands the surgical procedure, even if in simple terms, and confirm they have a chance to ask questions. I also take time to listen to their concerns. Some patients may feel nervous or fearful, and acknowledging those emotions is key to building trust. Offering reassurance, answering questions, and using calming techniques, such as explaining that their team is highly experienced and that the procedure is routine, can often help alleviate anxiety. In some cases, I may offer relaxation techniques, such as deep breathing, to help the patient feel more at ease. In addition, I ensure that the patient's family members are informed and reassured about the surgery process, as their support can also be a source of emotional comfort for the patient. By addressing both the physical and emotional aspects of care in the preoperative phase, I help set the stage for a smoother surgical experience, making the patient feel more confident and less anxious about the procedure ahead.
Describe your experience with patient positioning during surgical procedures and the importance of preventing injury.
Patient positioning during surgical procedures is a critical aspect of perioperative care, as it directly impacts both the success of the surgery and the patient's safety and comfort. Over the course of my experience as a perioperative nurse, I've gained extensive practice in positioning patients for a variety of surgeries, from general and orthopedic procedures to more specialized surgeries, each requiring specific positioning techniques. The importance of patient positioning cannot be overstated. Proper positioning not only ensures optimal exposure of the surgical site but also minimizes the risk of complications, such as pressure sores, nerve damage, joint dislocation, or respiratory complications. Additionally, the patient's circulation and comfort during surgery must be carefully managed to prevent injury and promote a safe recovery. When positioning patients, I always start by assessing the patient's specific surgical needs, body type, and any pre-existing conditions, such as limited mobility or spinal issues, which may influence positioning. I also make sure to communicate with the surgical and anesthesia teams to ensure we all understand the optimal positioning for the procedure. For example, for lithotomy position, used in pelvic or gynecological surgeries, I ensure that the legs are supported evenly, with no excessive pressure on the hips or knees. In prone positioning, common in spinal surgeries, I focus on proper padding to avoid pressure on the abdomen and chest, ensuring that the patient's airway is unobstructed and that circulation is maintained. The use of positioning devices and supports is essential to prevent injury. I'm skilled in utilizing foam pads, wedges, and pillows to provide support to bony prominences, such as the knees, elbows, and heels, which are vulnerable to pressure sores. I also ensure that there's adequate support for the head and neck, preventing unnecessary strain on these areas. During long surgeries, I am vigilant about monitoring for any changes in circulation, ensuring that the patient's limbs are properly aligned to avoid nerve compression or ischemia. Maintaining proper alignment of the spine, ensuring that the patient's body is balanced, and avoiding any extreme flexion or extension are key factors in preventing nerve injury. I also make sure to monitor the temperature regulation of the patient throughout the procedure, using warming blankets or cooling devices as necessary to prevent hypothermia or heat retention, which can affect the patient's comfort and circulation. Finally, during the procedure, I continuously assess the patient's positioning and make adjustments if necessary, always keeping an eye on pressure points and ensuring that the surgical site remains appropriately exposed. After the surgery, I monitor the patient closely during recovery, watching for signs of pressure ulcers or other complications arising from prolonged positioning. In summary, proper patient positioning is integral to preventing injuries and ensuring both the success of the surgery and the patient's well-being. My experience has taught me to be thorough, attentive, and proactive in positioning patients, always prioritizing safety, comfort, and the prevention of complications.
How do you monitor patients during surgery? What vital signs and parameters are critical?
During surgery, monitoring patients is a crucial aspect of ensuring their safety and well-being throughout the procedure. As a perioperative nurse, I understand the importance of vigilant observation and real-time communication with the surgical and anesthesia teams to detect any changes or complications promptly. My approach to monitoring patients during surgery involves a combination of technology, clinical knowledge, and constant attention to the patient's needs. The primary parameters I monitor include vital signs such as heart rate, blood pressure, respiratory rate, oxygen saturation levels, and temperature. These indicators provide immediate insight into the patient's circulatory, respiratory, and thermoregulatory status. For example, I closely observe the blood pressure for any signs of hypotension or hypertension, which could indicate bleeding or an anesthetic complication. Heart rate is another critical parameter. Any sudden changes can signify arrhythmias or other cardiac concerns, especially if the patient is undergoing a high-risk procedure. Respiratory rate and oxygen saturation are particularly important, as they help assess the patient's ability to ventilate adequately and ensure that oxygen delivery is optimal, especially when the patient is under general anesthesia. I also monitor urine output and ensure that the patient's positioning doesn't compromise circulation, as reduced perfusion to the kidneys can be an early indicator of issues. Additionally, I maintain awareness of the patient's blood glucose levels, particularly for diabetic patients, as fluctuations in glucose can lead to complications if not managed appropriately during surgery. In collaboration with the anesthesia team, I ensure that the patient's anesthesia levels are carefully controlled, and that they are maintained within the safe parameters throughout the procedure. This involves regular communication with the anesthesia provider to verify that medications are being administered correctly and that the patient remains adequately anesthetized without becoming oversedated. Another key responsibility I have is to monitor the surgical site itself, ensuring that the sterile field is maintained, and that no infection or external factors are compromising the surgical procedure. I'm also responsible for assisting the surgical team in maintaining proper patient positioning and ensuring that no pressure points develop, which could cause injury or complications after surgery. To summarize, monitoring a patient during surgery involves continuous and vigilant assessment of critical vital signs and parameters. I remain proactive, working closely with the surgical and anesthesia teams to promptly identify and address any potential issues, all while prioritizing the patient's safety and comfort. This role requires a high level of attention to detail, communication, and the ability to respond quickly and appropriately to changes in the patient's condition.
Discuss your knowledge of different types of anesthesia and their potential complications.
My understanding of anesthesia is based on a broad knowledge of the various types used in surgical procedures, as well as their potential complications. Anesthesia is a critical aspect of surgery, and it's essential to recognize the different types to ensure that patients are managed safely and appropriately based on their specific needs, the nature of the surgery, and their overall health. The main types of anesthesia include general anesthesia, regional anesthesia, and local anesthesia. Each has its own indications, advantages, and risks. General anesthesia is commonly used for more invasive surgeries, as it induces a controlled, reversible loss of consciousness. It involves the administration of intravenous medications and inhaled gases to ensure that the patient is unconscious, immobile, and free from pain during the procedure. One of the primary concerns with general anesthesia is maintaining the patient's airway and ensuring that their respiratory and cardiovascular systems remain stable throughout the surgery. Complications can include hypotension, hypoxia, aspiration, malignant hyperthermia, or postoperative nausea and vomiting, PONV. Malignant hyperthermia, though rare, is a life-threatening reaction to certain anesthetic agents that causes a rapid increase in body temperature and muscle rigidity. It requires immediate intervention, such as discontinuing the anesthetic agent and administering dantrolene. Regional anesthesia involves blocking nerve transmission in a specific area of the body. The most common types are spinal anesthesia, epidural anesthesia, and nerve blocks. These types of anesthesia are typically used for procedures involving the lower abdomen, pelvis, or limbs. With regional anesthesia, patients remain awake or lightly sedated but do not feel pain in the targeted region. Complications can include hypotension, infection, and nerve injury. One potential complication of spinal anesthesia is post-dural puncture headache, PDPH, which can occur if the needle punctures the dura mater. Managing this requires careful positioning and hydration, and sometimes an epidural blood patch may be necessary to treat PDPH. Another potential complication is neurological injury, which is rare but can happen due to accidental needle placement or local anesthetic toxicity. Local anesthesia is used for minor surgical procedures where only a small, localized area needs to be numbed. This type of anesthesia typically involves the injection of anesthetic agents such as lidocaine or bupivacaine directly into the tissue. Local anesthesia is generally considered low risk, but complications can include allergic reactions, local irritation, or nerve damage at the injection site. In cases where the anesthetic is administered in excessive doses, there is a risk of systemic toxicity, which can affect the cardiovascular and central nervous systems, potentially leading to symptoms such as dizziness, tinnitus, and seizures. In addition to understanding the different types of anesthesia, I also recognize the importance of assessing patient-specific risks, such as pre-existing medical conditions like cardiovascular disease, respiratory conditions, renal or hepatic impairment, or allergies, all of which can influence the anesthetic choice and the patient's response. Anesthesia providers rely heavily on the preoperative assessment to customize the anesthetic plan, ensuring the patient's safety throughout the procedure. Post-operatively, the risks associated with anesthesia do not end. Patients are closely monitored for complications like delayed awakening, airway obstruction, or respiratory depression, especially when transitioning from general anesthesia. It's also crucial to manage and monitor pain control post-operatively to avoid oversedation or opioid-related complications. In summary, my knowledge of anesthesia is grounded in an understanding of the different types and their associated risks. While the anesthesia team is responsible for administering and monitoring anesthesia, as a perioperative nurse, I play an important role in supporting these efforts by remaining vigilant for complications, assisting with patient positioning, and ensuring effective communication with the anesthesia and surgical teams throughout the procedure.
How do you anticipate the needs of the surgical team during a procedure?
Anticipating the needs of the surgical team during a procedure is an essential skill for a perioperative nurse, and it requires a combination of experience, attention to detail, and clear communication. To be effective in this role, I focus on staying proactive and aware of the various steps in the procedure, as well as understanding the flow of the surgery and the dynamics of the surgical team. One key aspect of anticipating needs is having a thorough understanding of the surgical procedure itself. Before the surgery, I review the patient's medical history, the type of surgery being performed, and any special considerations or potential complications that may arise. I also familiarize myself with the surgeon's preferences, equipment needs, and any specific steps of the procedure that might require additional support or instruments. This preparation allows me to be ready to meet the team's needs before they even arise. As the procedure begins, I stay focused on the sterile field, ensuring that instruments are readily available and properly organized. I anticipate the surgeon's need for specific instruments by observing their progress and knowing what will be required at each stage. For instance, I can prepare the next set of instruments or supplies for tissue dissection, suturing, or hemostasis before the surgeon even asks for them. This is particularly important in procedures with multiple stages or when the surgical team is working with limited time and concentration. By staying one step ahead, I help maintain a smooth and efficient workflow, minimizing delays and ensuring that the surgeon can focus entirely on the surgery. In addition to the technical preparation, I keep an eye on the environmental factors that impact the procedure, such as ensuring the proper lighting, maintaining a sterile field, and ensuring that the anesthesia team has all necessary monitoring equipment and medications. I monitor the patient's vital signs, anticipating any changes that may require immediate attention. For example, if I notice that the patient's blood pressure is dropping or that there's a sudden increase in bleeding, I am prepared to assist in managing these situations by alerting the appropriate team members or preparing supplies for hemostasis. Throughout the surgery, I remain attentive and responsive to the cues from the surgical team. This means not only being ready with instruments but also communicating effectively with both the surgical and anesthesia teams. If a complication arises or if there is a change in the procedure's direction, I can anticipate any adjustments that need to be made, whether it's preparing additional instruments, obtaining blood products, or adjusting patient positioning. Ultimately, anticipating the needs of the surgical team comes down to being well prepared, observant, and flexible. By understanding the procedure, staying organized, and keeping an open line of communication, I can provide timely support that enhances the overall efficiency of the surgery, reduces stress on the surgical team, and ensures that the patient's needs are met throughout the procedure.
Describe your experience with medication administration in the OR setting.
In my experience as a perioperative nurse, medication administration in the OR setting is an essential and highly responsible task that requires precision, careful attention, and clear communication with the surgical and anesthesia teams. As part of the team, I play a key role in preparing and administering medications to ensure the safety and comfort of the patient throughout the surgical process. One of the primary responsibilities I have in the OR is ensuring that all medications are correctly identified, prepared, and administered in accordance with established protocols. This includes verifying the medication's name, dose, route, and expiration date before administering it to the patient. I also double-check the patient's medical record to ensure that there are no contraindications or allergies related to the medications being used, and I remain mindful of the patient's specific medical conditions, such as renal or hepatic impairments, which could impact drug metabolism and clearance. The types of medications I work with in the OR vary depending on the nature of the procedure and the patient's needs. Some of the key categories include anesthetics. Both local and systemic anesthetics are used in the OR, and I assist in preparing and administering these under the direction of the anesthesia provider. This may involve preparing intravenous induction agents such as propofol or etomidate, as well as adjuncts like muscle relaxants or sedatives, to ensure the patient is adequately anesthetized. I am also involved in monitoring the patient's response to these medications and adjusting accordingly under the guidance of the anesthesia team. Analgesics. Pain management is another critical aspect of medication administration in the OR. I assist in administering analgesics, such as opioids, e.g., fentanyl, and non-opioid medications, either before, during, or after the procedure to ensure the patient remains comfortable. I am vigilant about the appropriate dosing to prevent oversedation or inadequate pain control. Antibiotics. In many surgeries, prophylactic antibiotics are administered to prevent postoperative infections. I make sure that antibiotics are prepared and given according to the surgeon's protocol, usually administered intravenously, and I verify the correct timing to ensure effectiveness. Other medications. Depending on the procedure, medications may include anticoagulants, antiemetics, and fluid and electrolyte replacements. I assist in administering these medications as needed, ensuring proper timing and dosage. In addition to administration, I also keep meticulous records of all medications used during surgery. This includes documenting the drug name, dose, time of administration, and the route. This documentation is vital for maintaining an accurate record for the patient's postoperative care, as well as ensuring compliance with hospital policies and legal requirements. One of the critical skills in medication administration in the OR is communication. Throughout the procedure, I maintain close communication with the anesthesia team, surgeon, and other staff, particularly when adjustments to medications need to be made based on the patient's vital signs or intraoperative findings. For instance, if a patient's blood pressure drops unexpectedly, the anesthesia team may need to adjust the dosage of anesthetics or administer vasopressors to stabilize the patient. Finally, I am fully aware of the potential complications associated with medication administration, such as adverse drug reactions, allergic responses, and medication errors. To mitigate these risks, I follow the 5 rights of medication administration: right patient, right drug, right dose, right route, and right time, and always maintain a high level of vigilance to ensure the patient's safety. In summary, My experience with medication administration in the OR has equipped me with a strong understanding of various medications and their proper use. By working collaboratively with the surgical and anesthesia teams, I ensure that the medications are administered safely, accurately, and effectively, contributing to the overall success of the procedure and the patient's well-being.
18. How do you participate in the surgical count procedure? Why is it important?
Participating in the surgical count procedure is one of the most critical aspects of maintaining patient safety in the operating room. As a perioperative nurse, I am fully involved in ensuring that all instruments, sponges, needles, and other materials used during the procedure are accounted for at each stage of the surgery. This process is vital to preventing retained surgical items, RSIs, which can lead to serious complications such as infection, sepsis, or additional surgeries. The surgical count procedure typically begins before the surgery when I assist the scrub nurse in setting up the sterile field. We count the instruments and materials needed for the surgery, including sponges and needles, ensuring that the correct number is available and ready for use. This initial count is performed in collaboration with the surgical team, including the circulating nurse and the scrub team. I am diligent in verifying that all supplies are accounted for and placed in the correct locations to ensure they are easily accessible when needed. Throughout the surgery, I maintain constant awareness of the instruments and materials being used. Whenever an instrument or sponge is handed off to the surgeon, I make a mental note or physically track the items to ensure that each one is returned to me after use. At each stage of the procedure, I work closely with the scrub nurse to track the instruments and ensure that nothing is inadvertently left behind. The critical part of the surgical count procedure is the final count, which occurs at the end of the procedure, before the patient is closed. During this final count, we confirm that all instruments, sponges, and needles have been accounted for and that no items are missing. If there is any discrepancy, the entire surgical team must work together to locate the missing item before the patient is closed and the surgery is complete. This process includes retracing steps, looking in all areas of the sterile field, and checking with the surgeon or anesthesia team to ensure nothing was left behind. The importance of the surgical count cannot be overstated. It is not only a patient safety issue but also a legal and ethical responsibility. By ensuring that all materials are accounted for, I help prevent the potentially devastating consequences of retained surgical items, which could lead to unnecessary harm, additional surgeries, extended hospital stays, and long-term health complications for the patient. Additionally, performing a thorough count builds trust within the surgical team, as everyone is confident that the procedure has been completed safely and that all instruments and materials are accounted for. Moreover, as part of the count process, I am vigilant about following institutional protocols and guidelines to minimize the risk of error. This includes maintaining a clear, organized count sheet and communicating effectively with the entire surgical team. The count procedure is a shared responsibility, and everyone plays a role in ensuring that the patient's safety is protected. In summary, my participation in the surgical count procedure is crucial for ensuring that all instruments, sponges, and materials are accounted for, reducing the risk of retained items and contributing to the patient's overall safety. It is a procedure that demands focus, communication, and teamwork, all of which are essential in creating a safe and successful surgical environment.
What are your responsibilities in the immediate post-operative phase, PACU handoff?
In the immediate post-operative phase, my responsibilities as a perioperative nurse during the PACU, post-anesthesia care unit, handoff are critical to ensuring the patient's safe transition from the operating room to the recovery phase. The handoff process involves detailed communication between the surgical team, anesthesia provider, and the PACU nurse, which is vital for maintaining continuity of care and addressing the patient's specific needs post-surgery. Firstly, I ensure that all the necessary documentation and information about the procedure are up to date and clearly communicated. This includes providing the PACU nurse with a comprehensive report that covers details such as the type of surgery performed, the anesthesia used, the patient's vital signs and response to anesthesia, and any specific intraoperative concerns. I ensure that the patient's airway has been secured, and I report on the type of anesthesia used, including any medications administered that may affect the patient's respiratory or cardiovascular function. I also provide information about any complications or intraoperative events, such as blood loss, changes in vital signs, or unexpected findings, so the PACU nurse can anticipate the patient's needs. I also give a clear report on the patient's pain management plan. This includes noting any opioids or analgesics administered during surgery, as well as any prescribed postoperative pain control methods such as PCA, patient-controlled analgesia, or non-opioid alternatives. I discuss the level of pain the patient is likely to experience upon waking and whether any additional medications are needed. Another key responsibility is ensuring that the patient's vital signs are stable and that any critical parameters, such as blood pressure, heart rate, temperature, and oxygen saturation, have been monitored and managed appropriately throughout the procedure. If there were any concerns about blood loss, electrolyte imbalances, or changes in the patient's condition during the surgery, I ensure the PACU team is aware so they can continue appropriate monitoring and interventions in the recovery room. I also provide an update on the patient's positioning during surgery, especially if there were any special considerations such as prone positioning or the use of positioning devices. This helps the PACU nurse ensure that the patient is properly supported and monitored for any potential complications such as pressure ulcers or nerve damage. Additionally, I report on the patient's fluid status, including any 4 fluids administered during surgery, and whether any additional fluids or electrolytes are needed in the immediate postoperative period. Lastly, I make sure to communicate any postoperative orders that are relevant for the PACU team, including instructions for wound care, dressing changes, or the need for any specific monitoring protocols such as vital sign frequency or oxygen supplementation. After the handoff, I remain available to assist the PACU team with any immediate needs, and I monitor the patient's progress, ensuring that all protocols for recovery are followed. I also ensure that the family or designated contact is informed about the patient's condition and expected recovery process once the patient has stabilized and is ready for discharge or transfer to the ward. In summary, my responsibilities during the PACU handoff include providing a detailed, accurate report on the patient's intraoperative course, pain management, vital signs, and any concerns or complications. This ensures that the PACU team can anticipate the patient's needs and provide the appropriate care in the immediate postoperative phase, ultimately contributing to a smooth, safe recovery. Effective communication and attention to detail during this handoff process are essential for preventing complications and ensuring the patient's continued well-being.
Discuss your understanding of potential postoperative complications and how you would recognize and respond to them.
Postoperative complications are an important consideration in patient care, as they can significantly affect recovery outcomes. As a perioperative nurse, I am trained to anticipate, recognize, and respond to potential postoperative complications in a timely and effective manner. My understanding of these complications, combined with vigilance and prompt intervention, ensures that patients receive the best care possible during the recovery phase. One of the most common and concerning postoperative complications is infection. Surgical site infections, SSIs, can occur if proper sterile techniques aren't followed or if the patient has underlying conditions like diabetes that increase their risk. Symptoms may include increased redness, warmth, swelling, or drainage from the surgical site, and in more severe cases, systemic signs such as fever or elevated white blood cell count. To prevent infection, I make sure to follow all wound care protocols, monitor the surgical site for any early signs of infection, and report any concerns to the surgical team. I also ensure the patient receives appropriate antibiotics as ordered, particularly if the procedure was high risk for infection. Hemorrhage or excessive bleeding is another critical complication. Postoperative bleeding may occur from the surgical site, internally, or from a clot that has formed. Symptoms of bleeding include a drop in blood pressure, tachycardia, and the appearance of blood in drains or dressings. I monitor the patient closely for any signs of hypovolemia, such as dizziness, pallor, or low urine output, and I would immediately notify the surgical team if significant blood loss is suspected. If necessary, I assist in managing blood products, for fluids, and apply pressure to the wound to control external bleeding. In severe cases, surgical re-exploration may be needed to control the bleeding. Pain management is another area where complications can arise. While some pain is expected after surgery, uncontrolled or poorly managed pain can result in complications such as increased stress, delayed healing, and even respiratory depression, particularly with opioid use. If the patient's pain is not well controlled, I assess the effectiveness of the prescribed pain management plan and work with the anesthesia team or the surgical team to adjust medications or provide additional support, such as regional blocks or alternative analgesics. I also carefully monitor for signs of opioid-related side effects, including nausea, constipation, or respiratory depression, and address them promptly. Deep vein thrombosis, DVT, and pulmonary embolism, PE, are significant postoperative risks, especially for patients undergoing major surgeries or those with limited mobility. Signs of DVT may include swelling, redness, or tenderness in the legs, while PE can present as sudden shortness of breath, chest pain, or hypoxia. To minimize the risk, I ensure that patients receive proper prophylactic measures, such as compression stockings, anticoagulant therapy, and early mobilization post-surgery. If I suspect a DVT or PE, I immediately inform the medical team and assist with diagnostic procedures, such as ultrasound for DVT or a CT scan for PE. Another complication I watch for is respiratory distress. After surgery, particularly with general anesthesia, patients may experience difficulty breathing, shallow respirations, or hypoxia. This could be due to the effects of anesthesia, atelectasis, or aspiration. I monitor the patient's oxygen saturation levels and assist with interventions such as deep breathing exercises, incentive spirometry, and adjusting the patient's position to facilitate lung expansion. If there are signs of significant respiratory compromise, I alert the anesthesia provider or physician for further assessment and intervention. Urinary retention can also be an issue, especially in patients who have had pelvic or abdominal surgery or who received epidural anesthesia. Symptoms include difficulty voiding or a distended bladder. I monitor the patient for signs of urinary retention and assist with bladder scans or catheterization if necessary, following institutional protocols. Delirium or confusion is another potential postoperative complication, particularly in older adults or patients with a history of cognitive impairment. Delirium can present as agitation, disorientation, or altered consciousness. I stay alert to any behavioral changes and ensure the patient is oriented, maintaining a calm environment and providing reassurance. If delirium is suspected, I inform the medical team to evaluate potential causes, such as medication side effects, hypoxia, or infection. Finally, nausea and vomiting are common after surgery, particularly with the use of anesthesia or opioids. This can lead to dehydration and discomfort, and if severe, it could cause aspiration. I monitor the patient's tolerance of fluids, assess for signs of dehydration, and administer antiemetics as prescribed. I also position the patient to reduce the risk of aspiration if vomiting occurs. In response to these complications, early identification and communication with the surgical and anesthesia teams are key. By closely monitoring vital signs, assessing the surgical site, administering medications as ordered, and supporting the patient's comfort and recovery, I can minimize the impact of postoperative complications. Ensuring patient safety and facilitating a smooth recovery is at the heart of my role as a perioperative nurse.
How do you document patient care accurately and efficiently in the perioperative setting?
Accurate and efficient documentation in the perioperative setting is crucial for patient safety, continuity of care, and compliance with hospital policies and legal requirements. As a perioperative nurse, I take great care to ensure that all aspects of patient care are thoroughly documented throughout the surgical process, from preoperative assessments to the postoperative phase. In the preoperative phase, I begin by documenting the patient's medical history, including allergies, comorbidities, medications, and any relevant laboratory or diagnostic test results. I also document the details of the informed consent process, ensuring that the patient understands the procedure, its risks, and the expected outcomes. This documentation serves as a foundation for all subsequent care and allows the surgical team to proceed with the appropriate plan. Additionally, I document the patient's baseline vital signs, skin condition, and any other relevant physical assessments. All of this information is entered into the electronic health record, EHR, or paper chart, as per the hospital's protocol. During the intraoperative phase, I focus on documenting any important events or changes in the patient's condition, such as vital sign fluctuations, medication administration, surgical interventions, or the use of special equipment. This includes recording the specific anesthesia agents and dosages used, as well as blood loss, fluid administration, and medications given during the procedure. I also ensure that the surgical count, instruments, sponges, needles, is documented accurately after the initial count and final count, as part of the safety protocols. Any complications or unexpected events that occur during the surgery, such as changes in the patient's condition or the need for additional interventions, are clearly noted. For example, if the patient experiences a sudden drop in blood pressure during the surgery, I would document the exact time, the interventions that were taken, such as fluid administration or medication given, and the patient's response. This documentation is vital not only for legal purposes but also to ensure the surgical team is aware of any changes that may impact the patient's recovery. In the postoperative phase, my documentation continues to track the patient's condition and recovery. I record the patient's initial vital signs upon arrival in the PACU, noting their pain level, any analgesics administered, and their response to those medications. I also document the patient's postoperative condition, including wound care, urinary output, and nausea/vomiting management. I ensure that any discharge instructions or follow-up care plans are recorded and that the patient or their family is educated on the next steps in the recovery process. Throughout the process, I am diligent about ensuring that my documentation is accurate, clear, and concise. I use standardized terminology and abbreviations as per the hospital's policy to avoid confusion, and I always document in real time when possible. This helps avoid errors that could occur from relying on memory and ensures that the chart is complete and accurate at all stages. Another important aspect of efficient documentation is legibility and timeliness. Whether documenting electronically or on paper, I ensure that all entries are legible and that the time and date are clearly recorded. In the electronic system, I use templates where appropriate to streamline documentation while ensuring all necessary information is included. Additionally, I avoid excessive charting and stick to essential facts to make the charting process more efficient and reduce the risk of extraneous or incomplete entries. Finally, I collaborate with the entire surgical team during documentation to ensure that all relevant information is captured. For example, if there are changes in the surgical plan, I ensure those are documented, and if the anesthesia team administers any medication, I confirm that those details are also recorded. Clear and thorough communication between team members ensures that all aspects of patient care are documented accurately and comprehensively. In summary, accurate and efficient documentation in the perioperative setting requires attention to detail, adherence to hospital protocols, and effective communication with the surgical team. By documenting each phase of care, preoperative, intraoperative, and postoperative, I help ensure the patient's safety, continuity of care, and compliance with regulatory standards.
What are your top priorities in ensuring patient safety in the OR?
Ensuring patient safety in the operating room, or, is my highest priority, as it is fundamental to providing quality care and achieving positive surgical outcomes. To ensure patient safety, I focus on several key areas, each requiring attention to detail, clear communication, and adherence to best practices. One of the first and most critical priorities is ensuring sterile technique. Infections are a significant concern in the OR, and maintaining a sterile field is crucial to minimizing the risk of surgical site infections, SSIs. I rigorously follow established protocols for sterile draping, gowning, and handling instruments to prevent contamination. I also make sure that all surgical instruments and supplies are properly sterilized and are ready for use before the procedure begins. Any lapse in maintaining sterility could result in infection, so I stay vigilant throughout the entire procedure, from setup to the final dressing application. Another priority is ensuring correct patient identification and surgical site verification. This is a critical safety step to prevent wrong site, wrong procedure, or wrong patient surgeries, which are rare but catastrophic errors. I ensure that the patient's identity, surgical site, and procedure are verified multiple times, using both verbal and written checks, and that a timeout procedure is conducted before making any incisions. The timeout is a collective pause involving the entire surgical team to confirm that the correct patient is receiving the correct procedure on the correct site. This verification process is vital to avoid preventable errors and ensure patient safety. Monitoring the patient's vital signs is another top priority throughout the surgical procedure. Anesthesia, blood loss, and physiological responses to surgery can all impact a patient's condition. I monitor the patient's blood pressure, heart rate, oxygen saturation, and temperature continuously and work closely with the anesthesia team to address any abnormalities immediately. If there is any indication of a change in the patient's status, such as hypotension, bradycardia, or oxygen desaturation, I am proactive in assisting with interventions such as fluid resuscitation, administering medications, or adjusting the patient's positioning. Timely recognition and response to changes in vital signs are critical to maintaining patient safety. Ensuring effective communication within the surgical team is essential for patient safety. I make sure that I communicate clearly and regularly with the anesthesia provider, surgeon, scrub nurse, and other team members throughout the procedure. If any unexpected events arise, such as complications or changes in the surgical plan, I ensure that the entire team is promptly informed so that we can respond swiftly and collaboratively. The open exchange of information is vital for a coordinated approach to patient care and safety. Another critical priority is managing medications safely. This includes verifying the correct medications, dosages, and routes before administration, as well as keeping a clear record of all drugs given during the procedure. I carefully follow the 5 rights of medication administration: right patient, right drug, right dose, right time, right route, and pay close attention to potential interactions or contraindications. Administering the wrong medication or dose could have severe consequences, so I remain vigilant and ensure that all medications are handled with care and accuracy. Instrument and sponge counts are an essential part of maintaining patient safety. I work closely with the scrub nurse to ensure that all instruments and sponges are accounted for before, during, and after the procedure. At the beginning of the surgery, we count all items, and we perform a final count at the end before closing the patient. This is done to ensure that no instruments or sponges are inadvertently left inside the patient, which can lead to serious complications like infections or internal injury. The surgical count procedure is a key safety measure in preventing retained foreign objects. Lastly, post-operative care and monitoring are critical for patient safety. After the surgery is completed, I ensure a safe handoff to the post-anesthesia care unit, PACU, by providing detailed and accurate information about the patient's condition, including any anesthesia-related concerns, pain management plans, and monitoring needs. I also make sure the PACU team is aware of any potential complications that may arise, such as bleeding or respiratory issues, and that appropriate interventions are in place. In summary, my top priorities in ensuring patient safety in the OR include maintaining sterile technique, verifying the patient and surgical site, continuous monitoring of vital signs, clear communication with the surgical team, safe medication administration, thorough instrument and sponge counts, and careful post-operative monitoring. By focusing on these areas, I help ensure that patients undergo surgery in the safest possible environment, with all potential risks carefully managed.
Describe the different types of surgical site infections and strategies to prevent them.
Surgical site infections, SSIs, are a significant concern in the perioperative setting and can lead to severe complications, prolonged recovery, and even mortality. As a perioperative nurse, I understand the importance of identifying the different types of SSIs and implementing strategies to prevent them. SSIs are typically classified into three categories: superficial incisional infections, deep incisional infections, and organ/space infections. Each type requires specific strategies for prevention. Superficial incisional infections occur near the skin surface, usually within 30 days of surgery. These infections often present with redness, swelling, warmth, and purulent drainage at the incision site. They may also be accompanied by fever. Preventing superficial infections involves ensuring the skin is properly disinfected before surgery, using sterile technique when making incisions, and maintaining the integrity of the sterile field throughout the procedure. Additionally, the use of prophylactic antibiotics, administered before the incision is made, can help reduce the risk of superficial infections, particularly in surgeries where infection risk is higher. Post-operatively, proper wound care, including regular cleaning and dressing changes, is essential to minimize the risk of infection. Deep incisional infections, which occur deeper in the tissue layers, usually present within 30 days of surgery and may involve the fascia and muscle layers. These infections often require more intensive treatment, including longer courses of antibiotics and sometimes surgical drainage. To prevent deep incisional infections, maintaining strict aseptic techniques throughout the surgery is critical. This includes ensuring the operating room environment is as sterile as possible and minimizing the time the incision is exposed. Additionally, it's important to monitor the patient's glucose levels, as hyperglycemia can increase the risk of infection, especially in diabetic patients. Post-operative care, such as encouraging early ambulation to promote circulation, proper nutrition, and wound monitoring, also plays a role in preventing deep infections. Organ/space infections are the most serious type of SSI and occur when infection develops in a body cavity or organ following surgery. These infections are often associated with more complex surgeries, particularly those involving the abdominal, thoracic, or genitourinary regions. Prevention of organ/space infections begins with meticulous attention to sterile technique during the procedure, particularly when accessing internal organs. Ensuring that all instruments are sterile and that any potential contamination risks are minimized is vital. In addition, strategies like maintaining normothermia during surgery, since hypothermia increases the risk of infection, and using appropriate antibiotics to target potential pathogens are important steps. Post-operative monitoring for signs of infection, such as elevated white blood cell count, fever, or changes in the patient's vital signs, allows for early detection and intervention. In addition to these specific strategies for each type of infection, overall infection control practices are fundamental. This includes proper hand hygiene, thorough cleaning and disinfection of the operating room environment, and the use of sterile gowns, gloves, and drapes. Another significant factor is patient preparation before surgery. Educating patients about preoperative care, such as showering with antiseptic soap or using nasal decolonization with mupirocin for MRSA carriers, can help reduce the risk of infections. The timing and selection of prophylactic antibiotics are also critical in reducing the incidence of SSIs, especially in high-risk procedures. By ensuring these antibiotics are administered within the correct time frame, ideally within 60 minutes before the incision is made, we optimize their effectiveness in preventing infection. Overall, preventing SSIs requires a multifaceted approach that includes careful patient selection, thorough preoperative preparation, strict adherence to sterile technique during surgery, and diligent postoperative care. By focusing on these strategies, I help ensure that patients have the best possible outcomes and recover without complications related to infections. My commitment to these practices is integral to maintaining a safe and sterile environment and contributing to positive patient outcomes.
How do you adhere to infection control protocols in your environment?
Adhering to infection control protocols in the operating room, is paramount to ensuring patient safety and preventing complications such as surgical site infections, SSIs. As a perioperative nurse, I take infection control very seriously and make sure to follow established guidelines and institutional policies at every step of the surgical process. My commitment to infection prevention spans from preoperative preparation to postoperative care, ensuring that strict protocols are followed consistently. The first step in adhering to infection control protocols is the preoperative preparation of both the patient and the surgical environment. I begin by ensuring that the patient has followed any preoperative instructions, such as showering with antiseptic soap to reduce the bacterial load on the skin. For patients at high risk for infection, I may assist in the application of mupirocin nasal ointment to reduce nasal colonization of MRSA or other pathogens. I also review the patient's medical history to identify any risk factors, such as diabetes or immune system deficiencies, which may require additional precautions or modified infection control measures. Once the patient is prepared, I focus on sterilizing the surgical field. I ensure that sterile supplies and instruments are handled appropriately and that they are checked for sterility before use. This includes using sterile drapes to cover the patient and surrounding area, as well as ensuring the operating team is properly gowned and gloved. Every member of the surgical team adheres to the sterile field protocol, including wearing appropriate personal protective equipment, PPE, such as surgical masks, gowns, gloves, and face shields, depending on the procedure. Proper hand hygiene, such as thorough scrubbing and the use of alcohol-based hand sanitizers, is crucial before and after any patient contact. By adhering to these measures, I help maintain a sterile environment, which is critical in preventing contamination. During the surgical procedure, I maintain continuous vigilance to ensure that the sterile field remains intact. I closely monitor the sterile instruments and dressings, ensuring they are not touched by unsterile surfaces or individuals. The use of sterile technique during the procedure is essential, particularly when handling surgical instruments, sponges, and needles. I also ensure that the operating room is kept clean and that all instruments are handled according to infection control protocols, such as not allowing them to come into contact with non-sterile areas. Furthermore, I help prevent cross-contamination by coordinating the surgical count with the scrub nurse, ensuring that all instruments, sponges, and needles are accounted for before, during, and after the procedure. In terms of environmental infection control, I ensure that the operating room itself remains a sterile environment. This includes overseeing the appropriate cleaning and disinfecting of the OR before and after the procedure, with special attention to high-touch surfaces, such as door handles, light switches, and equipment. I work with the environmental services team to ensure that these areas are disinfected with the appropriate chemicals and that all waste is properly disposed of to prevent contamination. After the surgery, I continue to prioritize infection control in the postoperative phase. Proper wound care is essential to preventing infection, so I ensure that sterile dressings are applied and that the wound is monitored for any signs of infection, such as redness, swelling, or discharge. I also ensure that the patient receives the appropriate antibiotic prophylaxis if necessary, particularly in procedures with higher infection risks. Monitoring the patient for fever, changes in vital signs, or other symptoms of infection in the postoperative recovery phase is also a critical aspect of infection control. If there are any indications of infection, I immediately inform the surgical or medical team to implement appropriate interventions, including culture collection and adjustment of antibiotics. In addition, I remain vigilant regarding antibiotic stewardship. Ensuring that prophylactic antibiotics are administered at the appropriate time, within 1 hour prior to incision, is a key part of infection control. I also monitor the patient for any signs of antibiotic resistance or adverse reactions to medications. Finally, education plays a key role in infection control. I provide the patient and their family with clear instructions on post-operative wound care, signs of infection, and the importance of hygiene to reduce the risk of infection after discharge. This helps ensure the patient plays an active role in maintaining their own safety and recovery. In summary, my adherence to infection control protocols in the OR is thorough and multifaceted, encompassing everything from preoperative preparation and sterile technique during surgery to postoperative wound care and patient education. By consistently following these protocols, I help ensure a safe surgical experience for the patient, minimize the risk of infection, and contribute to the overall success of the surgical outcome.
What is your understanding of the Universal Protocol for preventing wrong site, wrong procedure, wrong person surgery?
The Universal Protocol is a critical safety measure developed to prevent wrong site, wrong procedure, and wrong person surgeries. It is a set of standardized procedures designed to ensure that every aspect of the surgical process is thoroughly verified before the surgery begins, throughout the procedure, and even in the postoperative phase. The Universal Protocol is fundamental to maintaining patient safety and preventing these catastrophic errors, which can lead to serious complications, prolonged recovery, and even death. My understanding of the Universal Protocol is based on 3 key elements: pre-procedure verification, marking the surgical site, and the timeout procedure. Pre-procedure verification is the first step in preventing wrong site surgery. This involves reviewing the patient's medical records, surgical orders, and any relevant imaging or diagnostic information. As a perioperative nurse, I am involved in ensuring that all necessary documents and assessments are available and that the correct procedure is scheduled for the right patient. This includes reviewing the patient's identification, confirming the procedure, and verifying the surgical site. This process also involves verifying any special requirements, such as specific implants or prosthetics that will be used during the surgery. The second key component of the Universal Protocol is marking the surgical site. This is especially important for procedures where there are multiple potential sites of surgery or when there is a possibility of confusion regarding the site or location. The surgical site must be clearly marked before the patient is taken to the operating room. The marking is done by the surgeon, and it should be visible after the patient has been positioned for surgery. I ensure that the site is marked correctly, and I double-check with the surgical team to confirm that the marking is visible and appropriate. If the site marking is not visible or there is any doubt, it is vital that the surgeon remarks the site. This simple step can help prevent mistakes related to surgical site identification. The final, and perhaps most crucial, part of the Universal Protocol is the timeout procedure. This occurs immediately before the incision is made and involves a formal pause by the entire surgical team. During the timeout, the surgical team collectively verifies the patient's identity, the surgical site, the procedure, and any special considerations related to the surgery. This includes a final confirmation of the patient's name, date of birth, the surgical procedure, the correct surgical site, and any additional necessary equipment or materials. All members of the surgical team, including the surgeon, anesthesiologist, scrub nurse, and circulating nurse, are involved in this process, and it is essential that everyone speaks up if there are any concerns. The timeout is an opportunity for the team to catch any discrepancies before proceeding with the surgery. In addition to these primary components, the Universal Protocol emphasizes that these steps are not only a one-time check but should be part of a continuous verification process that involves constant communication and collaboration among the surgical team. The timeout procedure, for example, should happen at every stage of the surgical process, including at the beginning of the procedure and after any significant changes. This ongoing verification ensures that the team remains vigilant throughout the surgery. As a perioperative nurse, my role in the universal protocol is to ensure that the correct procedure is being performed on the correct patient, at the correct site, and that the entire team adheres to the timeout procedure. I am responsible for confirming the patient's identity, verifying the surgical site marking, facilitating communication among the team during the timeout, and ensuring that all necessary documentation and equipment are in place. My attention to detail and proactive communication with the surgical team help ensure that the universal protocol is followed thoroughly and that patient safety is always prioritized. In summary, the universal protocol is a comprehensive safety measure designed to prevent wrong site, wrong procedure, and wrong person surgeries. It consists of pre-procedure verification, marking the surgical site, and conducting a timeout before the incision is made. These practices help to ensure that the right procedure is performed on the right patient, at the right site, and with the right preparation, reducing the risk of catastrophic errors and ensuring patient safety.
How do you handle sharps safely in the OR?
Handling sharps safely in the operating room, OR, is of paramount importance in maintaining a safe and sterile environment for both patients and the surgical team. Sharps, including scalpels, needles, scissors, and other cutting or piercing instruments, present significant risks, including injury, infection, and the potential for blood-borne pathogen transmission. As a perioperative nurse, I am highly vigilant in following established protocols for the safe handling, disposal, and management of sharps throughout the entire surgical process. The first step in handling sharps safely is to maintain strict sterile technique when handling these instruments. During the procedure, I always ensure that sharp objects are kept within the sterile field and are handled by sterile team members. For example, I make sure that sharps are only passed between the surgeon and scrub nurse using a sterile technique, such as by using a sterile needle holder or forceps. I avoid touching sharp instruments with my bare hands, ensuring that they are always picked up and passed in a way that prevents accidental contact with non-sterile areas. During surgery, I remain vigilant in preventing accidental injuries from sharps. For example, I always ensure that sharps are never left exposed on the sterile field or in areas where they might fall or be accidentally touched by non-sterile team members. I also take care to never reach across a sharp instrument, reducing the risk of an unintentional puncture or cutting injury. If a sharp instrument is not being actively used, I make sure it is properly secured or placed in a designated container for immediate disposal when no longer needed. Additionally, I always stay alert to the movements of the surgical team, ensuring that sharps are never passed in an unsafe manner or in a way that could lead to inadvertent injuries. After the procedure, the safe disposal of sharps is one of my top priorities. I ensure that all sharp instruments, such as needles and scalpels, are disposed of immediately after use in an appropriate puncture-resistant, biohazard disposal container. I make sure that all sharps are placed in the container without touching the outside of the container to prevent any potential exposure. If a needle or scalpel must be recapped, I follow the no-hand technique, where the cap is placed onto the needle using a piece of sterile gauze or another instrument, never with my hands. This minimizes the risk of needle stick injuries. During the surgical count procedure, I make sure that all sharps, including needles and scalpels, are counted accurately before and after the procedure. This is a critical safety measure to ensure that no sharps are left inside the patient, which could lead to complications like internal injury or infection. If there is any discrepancy in the count, I immediately assist the team in conducting a thorough search to locate the missing item, ensuring that it is safely retrieved and documented. In addition to the direct handling of sharps, I also educate and reinforce the importance of safe sharps handling among the surgical team. I encourage open communication about sharps safety, particularly when handing instruments off or managing potentially dangerous items like needles. Everyone in the OR has a shared responsibility to maintain a safe working environment, and I make sure to lead by example in following protocols and speaking up if there is ever a concern about sharps safety. In summary, handling sharps safely in the OR requires a combination of maintaining strict sterile technique, remaining vigilant during the procedure, ensuring proper disposal practices, and fostering a culture of safety and communication within the surgical team. By adhering to these principles, I help minimize the risks of sharps-related injuries and infections, ensuring a safe environment for both patients and staff.
Discuss your knowledge of emergency procedures and your role in them, e.g., malignant hyperthermia, anaphylaxis.
In the perioperative setting, emergency procedures can arise unexpectedly, and having a clear understanding of these situations and knowing how to respond quickly and effectively is essential to ensuring patient safety. Emergencies in the operating room, or, may include a range of issues, from cardiac arrest to massive hemorrhage, equipment failure, or a sudden deterioration in the patient's condition. As a perioperative nurse, my role is to remain calm, stay focused, and take immediate action to support the surgical team in managing the emergency. One common emergency scenario in the OR is cardiac arrest. If a patient experiences a cardiac arrest during surgery, my role is to immediately alert the anesthesia team and initiate cardiopulmonary resuscitation, CPR, according to Advanced Cardiovascular Life Support, ACLS, protocols. I would also assist with the management of airway, breathing, and circulation, ensuring that the patient is properly intubated if necessary, that chest compressions are being performed effectively, and that medications such as epinephrine or atropine are administered as directed by the ACLS guidelines. Additionally, I would assist in obtaining any equipment or medications that may be required, including defibrillators or emergency drugs. Another emergency that can occur during surgery is massive hemorrhage. If a patient begins to experience significant bleeding, my role is to immediately alert the surgical team so that they can address the source of the bleeding as quickly as possible. I would assist the team by ensuring that the necessary supplies, such as additional gauze, hemostatic agents, or blood products, are readily available. I would also monitor the patient's vital signs closely for signs of shock, such as hypotension, tachycardia, or decreased oxygen saturation, and communicate these findings to the team. Additionally, I would ensure that the patient's blood loss is documented, and I would be prepared to assist with transfusion protocols if required. By staying organized and calm, I can help the team respond swiftly and effectively to control the bleeding and stabilize the patient. Anaphylaxis is another potential emergency in the OR, particularly in response to medications, antibiotics, or latex. If an anaphylactic reaction occurs, my role is to immediately recognize the signs, such as swelling, difficulty breathing, or a sudden drop in blood pressure, and inform the team. I would assist with administering epinephrine, managing the patient's airway, and providing oxygen if necessary. I would also work closely with the anesthesia team to monitor the patient's response and prepare for further interventions if the reaction progresses. Early recognition and quick administration of the appropriate medications are critical in preventing the progression of anaphylaxis to a life-threatening situation. Airway compromise is another critical emergency that can arise during surgery, especially with patients under general anesthesia. If a patient's airway becomes obstructed or they experience difficulty in ventilation, I would work closely with the anesthesia team to assist in clearing the airway, positioning the patient appropriately, and managing ventilation. I am trained to assist with techniques such as jaw thrust, intubation, or insertion of an airway adjunct, depending on the situation. Monitoring the patient's oxygen saturation and ensuring that the airway remains patent is essential to maintaining adequate oxygenation and preventing hypoxia. Malignant hyperthermia, MH, a rare but life-threatening condition triggered by certain anesthetic agents, is another emergency that requires immediate attention. Symptoms include a rapid rise in body temperature, muscle rigidity, tachycardia, and acidosis. If I recognize these symptoms, my first action would be to alert the anesthesia team and initiate treatment according to MH protocols. This involves discontinuing the triggering agents, administering dantrolene to reverse the reaction, and taking steps to cool the patient's body temperature, such as applying ice packs or infusing cold fluids. Ensuring that MH-specific equipment, such as dantrolene, is available and ready to use is an important part of emergency preparedness in the OR. In the event of equipment failure, I am prepared to troubleshoot or assist in resolving the issue. If critical equipment such as the anesthesia machine, defibrillator, or electrocautery device fails, my role is to immediately alert the appropriate team members, switch to backup equipment if necessary, and assist in maintaining patient safety while the issue is resolved. I would also document the equipment failure and any actions taken to ensure patient safety during the event. Communication is crucial during any emergency procedure, and I make sure to clearly communicate with the entire surgical team, ensuring that everyone is aware of the situation, understands their role, and is ready to act. In addition to following established protocols and guidelines, I remain calm and focused, which helps reduce stress and enhances the team's ability to respond effectively. After the emergency has been managed, I participate in debriefing and documentation of the event. This includes recording the timeline of events, the interventions performed, and any outcomes or changes in the patient's condition. A debriefing allows the surgical team to reflect on the emergency, identify areas for improvement, and ensure that any issues are addressed to enhance preparedness for future emergencies. In summary, my role in emergency procedures in the OR is to remain vigilant, communicate effectively, and act swiftly to ensure patient safety. Whether responding to cardiac arrest, massive hemorrhage, anaphylaxis, or other emergencies, I am trained to assist with life-saving interventions, provide support to the surgical and anesthesia teams, and contribute to the overall management of the emergency situation. By adhering to established protocols, remaining calm under pressure, and working as part of a cohesive team, I help ensure the best possible outcome for the patient.
How do you identify and report potential safety hazards in the OR?
Identifying and reporting potential safety hazards in the operating room, OR, is a critical part of my role as a perioperative nurse. Patient safety is the highest priority in the OR, and being proactive in recognizing and addressing potential hazards can help prevent harm and ensure a successful surgical outcome. There are various types of safety hazards in the OR, ranging from equipment issues and environmental hazards to risks associated with personnel or procedures. I am constantly vigilant and use a combination of observation, communication, and adherence to protocols to identify and mitigate these risks. The first step in identifying safety hazards is maintaining a constant awareness of the environment. I conduct a thorough assessment of the OR before the patient enters, checking for potential hazards that could affect patient safety. This includes ensuring that all equipment is functioning properly, that there are no obstructions on the floor or workspace that could pose a tripping hazard, and that all required instruments are sterile and ready for use. I make sure that all electrical cords are properly secured to avoid any risk of electrocution or tripping, and I check that lighting, ventilation, and the operating table are positioned correctly and functioning as expected. A significant safety hazard in the OR is equipment failure, and I am trained to recognize and address any malfunction quickly. I always check that the anesthesia machine, surgical instruments, electrocautery, and any other equipment required for the procedure are in proper working order. If I notice any issues, such as malfunctioning monitors, leaking gas lines, or unsterile equipment, I report these immediately to the relevant team members, whether it's the anesthesiologist, the surgical tech, or the biomedical engineer. For example, if the electrocautery unit fails, would immediately alert the surgeon, and we would switch to backup equipment if needed. I understand that equipment checks should be done both before and during the procedure to ensure that everything is functioning correctly. Another potential safety hazard is infection control. I constantly monitor the sterile field to ensure that it remains intact and free from contamination. If I notice a breach in sterile technique, such as an unsterile instrument or contamination in the surgical area, I immediately alert the team so that the issue can be corrected. I also stay vigilant about the use of personal protective equipment, PPE. If anyone on the surgical team is not properly dressed in sterile gowns, gloves, or masks, I speak up to make sure they follow the necessary infection control guidelines. Additionally, I make sure that all sharps are properly handled and disposed of in the correct containers to prevent injuries or cross-contamination. Communication is key to identifying and addressing safety hazards. I encourage an open line of communication with all members of the surgical team, including the surgeon, anesthesiologist, scrub nurse, and other staff members. If I notice any potential hazards, whether related to patient positioning, the surgical site marking, or the use of instruments, I communicate my observations clearly and promptly. For example, if I notice that the patient's position may lead to nerve compression or pressure ulcers, I will bring it to the attention of the surgical team so we can make adjustments before proceeding. Another important aspect of hazard identification is ensuring patient identification and site verification. Before surgery begins, I follow the universal protocol to confirm that the patient's identity and the surgical site are correct. I participate in the timeout procedure to verify that the right procedure is being performed on the correct site. If I notice any discrepancies, such as mismatched patient information or an incorrectly marked surgical site, I immediately alert the team so that the issue can be corrected before proceeding with the surgery. During the procedure, I remain alert to patient safety in terms of anesthesia, vital signs, and overall well-being. If there are any signs of potential complications, such as hypotension, arrhythmias, or changes in oxygen saturation, I report these findings to the anesthesiologist and the rest of the surgical team. For example, if the patient's oxygen saturation drops during surgery, I immediately notify the anesthesia provider so they can take action to ensure adequate ventilation. I also monitor for signs of bleeding or other complications, such as a drop in blood pressure or tachycardia, and communicate these concerns to the team. Finally, environmental safety is another aspect of hazard identification. I ensure that the operating room is free from any distractions or disruptions that could affect the team's focus. For instance, if there is noise, poor lighting, or temperature fluctuations, I make sure these issues are addressed promptly to ensure that the team can work efficiently and safely. I also pay attention to the condition of the surgical instruments, making sure that they are free from defects and are functioning as expected. If any issues arise with instrumentation, such as a broken or malfunctioning tool, I report this to the team immediately. Once potential hazards are identified, reporting them promptly and effectively is crucial. I follow the institution's reporting protocols to document any safety concerns, whether they relate to equipment, personnel, infection control, or environmental factors. This often involves notifying the charge nurse or supervisor, completing an incident report, and participating in any follow-up actions to address the issue. Reporting these hazards ensures that they are addressed promptly and that preventive measures can be put in place for future surgeries. In summary, identifying and reporting potential safety hazards in the OR involves constant vigilance, adherence to safety protocols, and effective communication. By thoroughly assessing the environment, monitoring equipment and infection control practices, ensuring patient verification, and maintaining a focus on overall patient safety, I am able to identify and mitigate potential hazards before they affect the outcome of the surgery. Reporting these issues is essential to ensuring that corrective actions are taken and that the OR environment remains safe for both the patient and the surgical team.
How do you communicate effectively with all members of the surgical team, even in high-pressure situations?
Effective communication is essential in the operating room, or, especially in high-pressure situations, where clear, concise, and timely communication can make the difference between a successful outcome and a serious complication. As a perioperative nurse, I prioritize communication as a fundamental part of my role, ensuring that all members of the surgical team are on the same page throughout the procedure. First and foremost, I believe in establishing a foundation of mutual respect and trust within the surgical team. By building strong professional relationships with the surgeons, anesthesiologists, scrub techs, and other staff, we can communicate more effectively and anticipate each other's needs. This trust creates an environment where everyone feels comfortable speaking up, asking questions, or providing suggestions, regardless of the pressure of the situation. I make it a point to approach each team member respectfully and encourage open dialogue, knowing that it can ultimately improve patient safety and the outcome of the surgery. When working in high-pressure situations, such as an emergency procedure or when unexpected complications arise, clarity and conciseness are crucial. During these times, I focus on delivering information quickly and accurately without unnecessary details that could lead to confusion or delay. For instance, if a sudden change in the patient's condition occurs, I communicate the relevant facts immediately, such as vital signs, lab results, or any other indicators that the team needs to be aware of. I use clear, direct language and avoid jargon to ensure everyone understands the situation. In an emergency, time is of the essence, and communication must be streamlined to facilitate swift decision-making and action. Another key aspect of communication in high-pressure situations is staying calm and composed. In stressful situations, emotions can run high, but it's essential that I maintain a calm demeanor. When I speak in a calm, controlled manner, it helps reduce the overall stress in the OR and sets the tone for the rest of the team. For example, if a complication arises, I focus on giving updates in a clear, steady voice and avoid panic or frustration. This helps everyone stay focused on the task at hand and ensures that critical information is communicated without unnecessary emotional interference. Active listening is another important component of effective communication. In a high-pressure environment, it's easy for team members to become overwhelmed or distracted, but I make sure to listen attentively to what others are saying. This allows me to respond appropriately, offer assistance when needed, and ensure that I am aware of any updates or changes in the procedure. Listening carefully also helps me pick up on nonverbal cues or subtle changes in tone that may indicate an issue, allowing me to address potential problems before they escalate. Additionally, I rely heavily on structured communication tools to ensure that important information is conveyed effectively. One example is the timeout procedure, which is part of the Universal Protocol. This procedure allows the team to pause and verify critical details before the surgery begins, such as the patient's identity, the surgical site, and the procedure being performed. This structured approach reduces the chance of miscommunication and ensures that everyone is on the same page. In high-pressure situations, I use similar structured communication techniques to clarify roles, confirm understanding, and check for any changes that may need to be addressed immediately. Furthermore, nonverbal communication plays a significant role in the OR, especially when there is limited time for verbal exchanges. For instance, I use eye contact, hand gestures, and body language to convey messages or provide assistance without interrupting the flow of the surgery. This is particularly helpful when the surgical team is focused on a delicate procedure and doesn't have the ability to communicate verbally. I also remain alert to nonverbal cues from others, such as a raised hand or a nod, indicating a request for help or confirmation. When high-pressure situations involve urgent decision-making or changes in the surgical plan, I ensure that decisions are communicated and understood by all team members. I avoid making assumptions and always clarify instructions if there is any uncertainty. For instance, if the surgical plan changes due to unforeseen circumstances, I confirm the new plan with the entire team, ensuring everyone is aligned. I always make sure to confirm that instructions are understood by asking for feedback or a repeat of critical information when necessary. Lastly, I believe in debriefing after the procedure, especially in high-pressure cases, to assess the effectiveness of our communication and ensure that we can improve for future situations. After the surgery, the team comes together to discuss what went well, what could have been improved, and any challenges that arose during the procedure. I am open to constructive feedback and always strive to learn from each experience, improving both my communication skills and the team's overall performance. In summary, effective communication in high-pressure situations requires clarity, calmness, active listening, and the use of structured tools. By fostering trust within the team, staying composed under pressure, listening carefully, and providing clear, direct information, I can contribute to a collaborative and efficient operating room environment. These practices help reduce the risk of errors, ensure patient safety, and ultimately lead to the best possible surgical outcomes.
Describe a time you had a conflict with a member of the surgical team. How did you resolve it?
In a fast-paced and high-stress environment like the operating room, it's not uncommon for differences in opinion or communication styles to arise among team members. I recall an instance during a particularly complex procedure where I found myself in conflict with a surgical tech regarding the handling of sterile instruments. The situation started when I noticed that some of the instruments were not being passed to the surgeon in a manner that adhered to sterile technique. This could have compromised the sterile field, so I felt it was crucial to address it immediately. At first, I was concerned about interrupting the flow of the surgery and potentially causing unnecessary tension, but I knew that patient safety came first. Instead of directly confronting the tech in front of the team, I took a moment to calmly step back and approach the issue in a way that would preserve the respect of everyone involved. I gently pulled the surgical tech aside and explained that I had observed a slight deviation from the sterile technique and shared my concern that it might affect the sterility of the instruments. I emphasized that we were all working towards the same goal, ensuring the patient's safety, and that open communication was essential for the success of the surgery. The surgical tech initially seemed defensive, as it was a high-pressure situation, and perhaps they hadn't realized the mistake. However, I made sure to keep my tone non-confrontational and focused on the safety of the patient rather than on assigning blame. I suggested a quick check-in with the scrub nurse to ensure that we could all get back on the same page without slowing down the process. The tech appreciated the private, respectful way I handled the situation and acknowledged that they might have missed a small detail in the rush of the procedure. We quickly made the necessary adjustments, and from that point on, communication improved between us for the remainder of the surgery. The tech became more aware of how the instruments were being passed, and I kept a close eye on ensuring that sterile technique was strictly followed. After the surgery, I made sure to follow up with the surgical tech in a non-critical way, checking in to see if they had any concerns or needed any additional support. This further helped to diffuse any lingering tension and reinforce the idea that we were all on the same team. In retrospect, I was glad that I approached the conflict with empathy and professionalism, as it not only resolved the immediate issue but also strengthened our teamwork and communication moving forward. In summary, handling conflict in the OR requires a careful balance of maintaining professionalism, focusing on patient safety, and addressing issues in a respectful and non-confrontational manner. By approaching the situation calmly, privately, and with empathy, I was able to resolve the conflict while maintaining a positive and productive working relationship with my colleague.
How do you advocate for the patient's needs within the surgical team?
Advocating for a patient's needs within the surgical team is a vital aspect of my role as a perioperative nurse, as it ensures that the patient's safety, comfort, and overall well-being are prioritized throughout the surgical process. This advocacy begins well before the surgery itself, continues during the procedure, and extends into the post-operative phase. I approach patient advocacy by acting as the patient's voice within the surgical team, ensuring that all concerns are addressed and that the team collaborates effectively to deliver the best care possible. Before surgery, I work to ensure that the patient's preferences and concerns are clearly communicated to the surgical team. This involves engaging with the patient during the preoperative phase to discuss their expectations, any questions they have about the procedure, and any specific needs or considerations, such as allergies, past surgical history, or cultural preferences. I make sure to convey this information accurately to the surgical team, anesthesiologists, and any other relevant members of the healthcare team, ensuring that they are fully aware of any factors that could impact the patient's care. For instance, if a patient has a fear of anesthesia or specific concerns about post-operative pain management, I ensure these are addressed proactively in the planning process, and I relay this to the anesthesia team so they can adjust their approach if needed. During the surgery itself, I continue to advocate for the patient by monitoring their condition closely and ensuring their safety. This involves vigilant monitoring of their vital signs, oxygen saturation, and overall response to the procedure. If I observe any signs of distress or instability, I immediately alert the surgical or anesthesia team. For example, if I notice a drop in the patient's blood pressure or changes in their vital signs that could suggest complications, I advocate for prompt intervention. I am particularly aware of potential risks such as pressure injuries, hypothermia, or infection, and I take steps to prevent them by ensuring the patient is positioned correctly, maintaining sterile technique, and supporting the team in implementing preventive measures. Furthermore, as a perioperative nurse, I am attuned to nonverbal cues or any subtle changes in the patient's condition that could indicate discomfort, anxiety, or a need for further intervention. I am trained to recognize when a patient is in pain or distress and ensure that their pain management plan is effectively followed. For example, if I observe signs of inadequate anesthesia depth or if the patient is experiencing discomfort, I immediately notify the anesthesia provider, who can assess and adjust the medication accordingly. Throughout the procedure, I also advocate for clear communication among the entire surgical team, ensuring that all members understand the patient's needs and that we are all aligned in terms of care priorities. This involves ensuring that everyone in the team, from the surgeon to the scrub nurse to the anesthesia team, understands the patient's unique concerns and any special requirements that have been communicated prior to and during the surgery. For example, if the patient is at higher risk for a specific complication, such as deep vein thrombosis, DVT, due to a history of blood clots, I make sure that the surgical team takes appropriate precautions, such as using compression devices or prophylactic anticoagulants, and I monitor for signs of any issues. I also advocate for the patient's post-operative care, ensuring that the patient's recovery needs are addressed immediately after the surgery. This includes ensuring that the patient is adequately monitored in the post-anesthesia care unit, PACU, managing pain effectively, and preventing complications such as nausea, vomiting, or infection. I communicate with the PACU staff about the patient's condition, including any specific concerns or preferences the patient has, so they are prepared to manage the patient's recovery accordingly. I also monitor for signs of post-operative complications, such as bleeding, infection, or respiratory distress, and advocate for timely intervention if necessary. One key aspect of advocacy is also making sure that the patient's dignity and privacy are respected. This involves ensuring that the patient is properly draped, their privacy is maintained, and that any communication about their condition is done discreetly and respectfully. For instance, if there are discussions about the patient's medical condition, I make sure that it is done in a way that maintains the patient's dignity and does not cause unnecessary stress or anxiety. Lastly, after the procedure, I ensure that the patient's concerns and feedback are addressed in the post-operative phase, either through a follow-up assessment or by communicating with the post-operative care team. I make sure that the patient receives adequate information about their recovery process, including instructions on wound care, signs of infection, and what to expect as they heal. If the patient has specific concerns, such as how to manage pain or how to follow up with their physician, I ensure that these concerns are addressed and that the patient feels supported throughout their recovery journey. In summary, advocating for the patient's needs within the surgical team requires proactive communication, vigilance, and a deep understanding of the patient's physical, emotional, and psychological needs. By ensuring that all aspects of patient care are considered, from preoperative preparation and safety during the procedure to postoperative recovery and follow-up care, I play a key role in ensuring that the patient's needs are met throughout the entire surgical process. Effective advocacy ensures that the patient's voice is heard and that their safety and well-being are always the priority.
How do you handle stressful situations and maintain composure in the OR?
Handling stressful situations in the operating room, or, and maintaining composure are crucial aspects of providing effective care, as the environment is inherently high pressure. As a perioperative nurse, my ability to stay calm and focused not only ensures patient safety but also helps maintain a productive and collaborative team dynamic during the procedure. I approach stressful situations with a combination of preparation, self-awareness, and effective communication. The first key strategy one uses is preparation. Before entering the OR, I always ensure that I am fully prepared, both mentally and physically. This includes reviewing the patient's medical history, understanding the specific requirements of the procedure, and ensuring that all equipment and instruments are sterile and ready for use. By preparing thoroughly, I reduce the likelihood of surprises or complications, which can alleviate stress during the procedure. Knowing that I am well prepared helps me stay confident and focused, even when unexpected situations arise. When a stressful situation occurs, I rely on my ability to stay composed under pressure. For example, during an emergency procedure or when complications arise, it's easy to feel overwhelmed, but I've learned that taking a deep breath and maintaining a calm demeanor helps me think more clearly and make better decisions. I remind myself that panicking does not benefit anyone, especially the patient, and that staying calm will enable me to contribute effectively to the team. I've also found that maintaining a calm voice when communicating with the surgical team helps set a steady tone and ensures that everyone stays focused on the task at hand. Prioritization is another important factor in handling stress. In the OR, it's essential to assess the situation quickly and identify what needs immediate attention. Whether it's a sudden drop in the patient's blood pressure or an equipment malfunction, I focus on the most critical issue first, addressing it before moving on to other concerns. This ability to prioritize allows me to stay organized and avoid becoming overwhelmed by the complexity of the situation. For example, if a patient's oxygen saturation drops, my first priority is to alert the anesthesia team and assist in stabilizing the patient, while simultaneously communicating with the rest of the surgical team about the situation. In addition, I rely on effective communication to manage stress. When things become tense in the OR, clear, direct communication is essential. I ensure that I convey my observations or concerns in a calm and concise manner, without hesitation. For example, if I notice something amiss, such as a change in the patient's vital signs or an issue with sterile technique, I address it immediately with the relevant team members. I am not afraid to speak up, and I understand that it's my responsibility to advocate for the patient, especially in critical situations. Clear communication helps reduce confusion and ensures that everyone on the team knows what needs to be done, which in turn helps reduce stress and increases the chances of a successful outcome. I also draw strength from my experience and training. Over the years, I have encountered a wide range of challenging situations, from unanticipated complications to emergency surgeries. This experience has taught me to stay focused on the patient and trust in the systems and protocols that are in place to manage stress and risks. Knowing that I can rely on these systems, and that I am part of a well-trained and supportive team, gives me confidence that we can handle whatever comes our way. Another technique I use to manage stress is taking short moments to reset. In high-pressure situations, it can be easy to feel rushed, but I've learned the importance of briefly stepping back mentally to regain focus. For instance, if there is a momentary lull in activity, I take a deep breath and mentally review the situation, ensuring that I am aware of the next steps and that I remain present and alert. This allows me to stay composed and avoid feeling overwhelmed. Lastly, I recognize the importance of debriefing after a stressful situation. Once a procedure is completed, I take time to reflect on how I handled the stress and what I can learn from the experience. I also participate in debriefs with the team, where we can openly discuss the procedure, how we work together, and any areas for improvement. This not only helps me learn from each situation but also strengthens team cohesion and prepares us for future challenges. In summary, handling stress in the OR requires a combination of thorough preparation, maintaining composure under pressure, clear communication, and the ability to prioritize tasks effectively. By staying calm and focused, I can manage stressful situations efficiently and contribute to a successful outcome for the patient. Additionally, the support of a well-coordinated team and the ability to reflect on each experience allow me to continuously improve my ability to perform under pressure.
How do you receive and provide constructive feedback to colleagues?
Receiving and providing constructive feedback are essential aspects of maintaining a high standard of care and fostering a positive, collaborative environment in the operating room, or. As a perioperative nurse, I view feedback as an opportunity for growth, both personally and professionally. I strive to approach these interactions with openness, respect, and a commitment to improvement for the benefit of the team and the patient. When receiving feedback, I prioritize active listening. I understand that constructive feedback, whether positive or critical, is a tool for my development and is focused on improving patient care and team performance. I listen attentively without interrupting, making sure to fully understand the points being made. If necessary, I ask clarifying questions to ensure that I am clear on the areas that require attention and improvement. I try to approach feedback with a mindset of growth, rather than defensiveness, understanding that no one is perfect, and we all have room for improvement. After receiving the feedback, I reflect on it and consider how I can apply the suggestions to enhance my practice. For example, if a colleague observes that I may have missed a small detail in the setup of instruments for a procedure, I take it as an opportunity to reassess my process and improve my preparation. I may ask them for additional advice on how I can prevent similar oversights in the future and discuss any resources or techniques that could help me refine my practice. It's important for me to stay open to feedback, as it allows me to improve and contributes to a safer and more efficient environment. When providing feedback to colleagues, I ensure that it is timely, respectful, and constructive. I approach these conversations with empathy and focus on the behavior or action, not the person. I aim to create an environment where feedback is viewed as a positive tool for growth, rather than as criticism. For instance, if I noticed that a colleague's actions could compromise sterile technique, I would gently approach them in private and discuss the situation. I would express my concern clearly and respectfully, for example, by saying, "I noticed that the sterile field wasn't maintained during the procedure, and I wanted to point it out so we can prevent any risks moving forward. Is there anything I can do to assist or make the setup clearer?" The key is to remain focused on the goal of improving patient safety and the functioning of the team. I try to balance my feedback by including positive reinforcement, highlighting things that went well alongside areas for improvement. If a colleague demonstrated good communication during the surgery or displayed exceptional skill in handling a difficult situation, I make sure to acknowledge that as well. This balanced approach makes it easier for the colleague to accept constructive feedback without feeling demoralized and helps maintain a positive and supportive atmosphere within the team. Additionally, I believe that feedback should be ongoing, not limited to just formal reviews. During daily interactions and in the midst of procedures, I offer real-time feedback when necessary, but always in a way that is non-disruptive to the team's focus. For example, if I notice that a colleague is becoming overwhelmed or is not following a specific protocol, I might offer a gentle reminder, such as, just a quick note to check that the surgical site is marked properly, so we don't miss any steps. These small gestures can help maintain standards without escalating into a bigger issue later on. Another important part of giving feedback is being specific and actionable. When I provide feedback, I ensure that it is clear and provides a way forward. Rather than vague comments like, "You need to be more careful," I would say, "I've noticed that there have been some issues with maintaining sterile technique during instrument handling. In the future, let's make sure that we double-check the sterile field before passing instruments to the surgeon." This kind of feedback is not only clear, but it also gives the colleague a concrete action to take in order to improve. Lastly, I make sure to provide follow-up on feedback. After a colleague has received constructive feedback, I like to check in later to see how they're doing and offer support if needed. If they've improved in a certain area, I make sure to acknowledge that progress, reinforcing the positive behavior and showing that I appreciate their efforts to implement the feedback. In summary, both receiving and providing constructive feedback require a balance of respect, clarity, and empathy. By focusing on behavior rather than personality, being specific and actionable in my suggestions, and offering ongoing support, I contribute to a learning environment that encourages growth and ensures the highest level of patient care. Constructive feedback, when given and received thoughtfully, helps us all improve and strengthens our collaboration as a team.
Describe a time when you had to think critically to anticipate a problem during a surgical procedure. What was your solution?
There was an instance during a complex laparoscopic procedure where I had to think critically to anticipate a potential issue before it became a problem. The surgery was progressing well, but I noticed that the patient's blood pressure was beginning to trend downward, though it wasn't yet at a critical level. While the anesthesia team was focused on other aspects of the procedure, I had a feeling that the position of the patient on the operating table might be contributing to the decline in blood pressure. Given the complexity of the surgery, which involved the use of a pneumoperitoneum to inflate the abdomen, I suspected that the pressure from the inflated abdomen might be impeding venous return and contributing to the hypotension. I also noted that the patient's legs were in a certain position that could exacerbate venous pooling, particularly in the lower extremities, adding to the problem. I didn't want to wait until the situation became more critical, so I took a moment to communicate my concern to the anesthesia team, suggesting that we adjust the patient's positioning slightly. I also recommended that we lower the pneumoperitoneum pressure to reduce the risk of further circulatory compromise. I proposed that the surgical team adjust the patient's position to relieve some of the pressure on the abdomen and the legs, which could potentially help restore venous return. The anesthesia team appreciated the suggestion and quickly made the necessary adjustments, lowering the pneumoperitoneum pressure and repositioning the patient to ensure better circulation. Shortly thereafter, the patient's blood pressure stabilized. By anticipating the problem early, I helped prevent a more significant issue that could have delayed the procedure or required more intervention. This experience reinforced the importance of always being vigilant in monitoring the patient's condition and thinking critically about how various factors in the environment might contribute to changes in their physiological status. By staying focused on the patient's well-being and proactively addressing the situation, we were able to keep the procedure on track and ensure the patient's safety throughout.
How do you prioritize tasks and manage your time effectively during a busy surgical schedule?
Prioritizing tasks and managing time effectively during a busy surgical schedule is crucial to ensure patient safety, maintain a smooth workflow, and prevent unnecessary stress in the operating room. I approach this by breaking down my responsibilities into urgent and non-urgent tasks, staying organized, and constantly reassessing the situation to adjust priorities as needed. A combination of preparation, efficient communication, and staying calm under pressure helps me manage time and tasks effectively. One of the first steps I take in managing a busy schedule is thorough preparation. Before the day's surgeries begin, I review the schedule, understand the details of each procedure, and prepare the necessary instruments, supplies, and equipment. This allows me to be proactive and ensures that I'm not scrambling to find things during the procedure. It's important to anticipate the needs of the surgical team and the patient so that everything runs as smoothly as possible. I also ensure that the necessary preoperative assessments and documentation are completed for each patient, which helps avoid delays later on. As surgeries progress, I prioritize tasks by constantly assessing the situation. For example, my first priority is always patient safety, so I make sure that sterile technique is maintained, equipment is functioning properly, and the patient's vitals are monitored closely. If there is a complication during surgery, I quickly shift my focus to address the issue while communicating with the surgical and anesthesia teams to manage it effectively. While some tasks can be planned out in advance, such as organizing instruments, others arise during the procedure and need to be handled promptly. I maintain flexibility in my approach to adjust to changing circumstances. When there are multiple procedures scheduled in a day, I also pay attention to the flow between cases. I ensure that the OR is cleaned and reset between procedures and that any necessary instruments are sterilized or replenished for the next surgery. I work with the scrub nurse and the surgical team to anticipate the needs of the next case and prepare accordingly. If there's a delay, I communicate clearly with the team to ensure everyone is on the same page regarding the new timeline. Effective communication is key to managing a busy schedule. I ensure that I'm in constant communication with the surgical team to clarify roles, confirm timelines, and address any changes. This includes checking in with the anesthesia provider about the patient's condition, confirming patient positioning with the surgical tech, and coordinating with the PACU nurse for a smooth handoff once the procedure is complete. When there are multiple surgeries in a day, clear communication helps the team stay organized and ensures that everyone is aware of what's happening and when. To keep things running smoothly, I use checklists and standard operating procedures whenever possible. For instance, I follow a specific checklist to ensure that every surgical site is prepared correctly, that all necessary supplies are available, and that we have everything ready for a smooth start. If new tasks arise, I note them on my mental checklist or jot them down briefly so that I don't lose track of what needs to be done. In particularly busy periods, I also recognize the importance of delegation. If there are tasks that I can pass along to other members of the team, such as preparing additional instruments or ensuring that a particular piece of equipment is sterilized, I delegate those tasks so I can stay focused on patient care and the critical aspects of the procedure. Delegation helps reduce my workload, ensures that the team works efficiently, and prevents the burnout of any one individual. Lastly, I try to remain calm and composed, even when things get hectic. Stress can create confusion, which in turn can delay tasks or compromise patient care. By staying organized and focused, I'm able to manage my time better and ensure that all necessary tasks are completed without compromising quality. I also make sure to take small moments to reassess priorities during the day. If one task becomes more urgent than another, I shift my focus accordingly. In summary, prioritizing tasks and managing time in a busy surgical schedule is about being well prepared, staying organized, communicating effectively with the team, and remaining adaptable to changes. By maintaining flexibility, being proactive, and focusing on patient safety and care, I am able to handle multiple tasks without sacrificing quality or efficiency.
What do you do when you encounter a situation you are unfamiliar with in the OR?
When I encounter a situation in the operating room, or that I am unfamiliar with, my first priority is always patient safety, so I approach it with a calm, systematic, and collaborative mindset. I understand that in the fast-paced and dynamic environment of the OR, there will inevitably be moments where unexpected situations arise, and it is crucial to respond in a way that ensures the best possible outcome for the patient. The first step I take is to stay composed. It's easy to feel overwhelmed or anxious when faced with something unfamiliar, but I remind myself that I am part of a well-trained team, and staying calm allows me to think clearly and contribute effectively. I take a moment to assess the situation and ensure that I have all the necessary information, such as reviewing the patient's medical history, understanding the procedure, and identifying the exact issue at hand. Once I have an understanding of the situation, I seek guidance or clarification from experienced team members. In the OR, collaboration is key, and I never hesitate to ask for help when needed. For example, if I encounter a new type of equipment or technique that I'm not familiar with, I will ask a colleague, such as the surgical tech or another nurse, for assistance. I've learned that most of my colleagues are more than willing to share their knowledge and support me in learning. By seeking their input, I can quickly resolve the issue while learning from the experience. If the situation involves a clinical challenge, such as an unexpected change in the patient's vitals, I immediately notify the appropriate team members, such as the anesthesia provider, surgeon, or other nursing staff, to address the issue together. I recognize the importance of clear and effective communication in these situations, as it ensures that the team is aligned and able to take immediate action. I also focus on the protocols and guidelines we have in place to manage complications or unexpected situations, as these provide a structured approach to handling crises. If there is uncertainty about a specific aspect of the procedure, I will review the surgical plan or consult any available resources. Sometimes, the situation might involve new technology or unfamiliar instruments, in which case I would refer to equipment manuals or ask for a demonstration from someone who is familiar with the setup. This step is especially important when new equipment is being used for the first time in the OR. For instance, if there's an issue with a piece of machinery or a particular surgical technique I'm not experienced with, I make sure to ask the right questions to ensure I understand how to proceed safely and effectively. Another strategy one uses when confronted with unfamiliar situations is staying organized and following established protocols. If the situation involves an unusual complication or unexpected event during surgery, I stick to the steps that are outlined in our surgical safety checklist or emergency protocols. These checklists are designed to reduce the chance of error, and even if I'm unfamiliar with some aspects of the situation, these steps offer a structured approach to resolving it. Finally, after the situation is resolved, I take time to reflect and learn. I review the experience to understand what happened and how I could approach similar situations in the future. I may discuss the situation with a mentor or supervisor to gain further insights into how I could have handled it differently or more efficiently. This reflection is an important part of continuous learning, which helps me improve my practice and become better prepared for future challenges. In summary, when I encounter an unfamiliar situation in the OR, I stay calm, seek guidance from my colleagues, communicate effectively, follow protocols, and take time to reflect on the experience. This approach ensures that I can respond to the situation in a way that prioritizes patient safety, promotes teamwork, and enhances my professional development.
How do you adapt to changes in the surgical schedule or unexpected events?
Adapting to changes in the surgical schedule or unexpected events is an essential skill in the operating room, as it can significantly impact patient care and the efficiency of the surgical team. I approach these situations with flexibility, effective communication, and proactive problem-solving to ensure that patient safety remains the top priority and that the team remains aligned and organized. When there's a change in the surgical schedule or an unexpected event, I first make sure to stay calm and focused. In the fast-paced environment of the OR, it's easy for stress to mount, but I've learned that maintaining composure helps me think clearly and manage the situation more effectively. I take a moment to assess the new situation and identify any immediate actions I need to take. If the change involves a shift in procedure or timing, I quickly review the updated schedule and adjust my preparations accordingly. This could mean preparing new instruments or adjusting patient positioning, depending on the specifics of the new procedure. If there's a delay in the schedule, I work with the team to make sure that all equipment is ready, the OR is cleaned, and the next patient is prepared. I also ensure that the necessary documentation is updated to reflect the change, so we're all on the same page. For example, I've had occasions where a surgery was delayed, and the surgeon had to attend to an emergency case in another room. During this time, I communicated with the rest of the team, ensured that the OR was ready, and coordinated the preparation for the next case, including checking that the patient was properly positioned and all instruments were sterilized. By staying organized and flexible, I was able to smoothly transition between cases without any unnecessary delays. When there are unexpected complications or changes during a procedure, I focus on quickly identifying the issue and communicating it to the rest of the team. If the situation requires a change in the plan, I work closely with the surgeon, anesthesiologist, and surgical tech to adapt our approach. For instance, if the patient's vitals suddenly change, or if equipment malfunctions, I immediately notify the team and help implement the necessary adjustments. This may involve altering the positioning, adjusting the surgical approach, or bringing in backup equipment. In these situations, effective and clear communication is critical to ensure that all team members are aware of what's happening and how to proceed. If there is a last-minute change in the type of anesthesia or a shift in the surgical approach, I review any potential impact it may have on the procedure and ensure the team is updated. I also make sure that the patient's safety is not compromised and that all necessary steps are taken to adjust for the change. In terms of patient care, when a change occurs, I keep the patient's well-being at the forefront. If there are delays or if the procedure is altered, I make sure the patient is kept informed, if appropriate, and that their preoperative care is adjusted to reflect the new circumstances. I check in with the anesthesia team to ensure the patient is stable and address any additional needs the patient may have during the change in schedule. Communication is key when adapting to changes. I make sure to regularly check in with all members of the team, from the surgeon and anesthesiologist to the scrub tech and circulating nurse, to confirm that everyone is on the same page regarding the changes. I also maintain a clear line of communication with the patient's family or designated contact person, providing updates when necessary and managing expectations. This helps to ensure that everyone is informed, which reduces stress and prevents confusion. Additionally, I stay organized and flexible, ensuring that all logistical aspects are handled smoothly, from managing surgical instruments to keeping the OR environment clean and ready for the next procedure. For instance, if we have a sudden change of schedule, I recheck equipment readiness, review any changes to the surgical plan, and keep track of the new timelines. I try to anticipate the needs of the surgical team, ensuring that all preparations are made efficiently and without delays. After any significant change or unexpected event, I always take a moment to reflect on the situation. This helps me learn from the experience, whether it involves understanding how better to manage changes or reviewing ways to improve communication and coordination with the team. It also helps me prepare for future instances when I may encounter similar disruptions. In summary, adapting to changes in the surgical schedule or unexpected events requires a combination of staying calm, being organized, communicating effectively, and remaining flexible. By focusing on these elements, I ensure that the surgery proceeds as smoothly as possible, regardless of the challenges we may face, while prioritizing patient safety and maintaining an efficient, collaborative environment.
What are your understanding of professional boundaries in the nurse-patient relationship in the perioperative setting?
In the perioperative setting, maintaining professional boundaries in the nurse-patient relationship is crucial to ensuring high-quality care, patient safety, and a respectful, ethical environment. The nurse-patient relationship in the operating room, is unique because it requires a balance of clinical professionalism, compassionate care, and clear boundaries, all while maintaining the sterile environment and focusing on the surgical procedure. My understanding of professional boundaries in this context centers around respecting the patient's dignity and autonomy while ensuring that the nursing role is focused on providing safe, effective, and unbiased care. One of the key aspects is recognizing that the patient is in a vulnerable state, both physically and emotionally, and it's important to maintain a professional distance that ensures the patient feels safe and respected without compromising the integrity of the nursing role. First and foremost, I prioritize clear, respectful communication with the patient before the surgery. This includes introducing myself, explaining my role in the OR, and addressing any questions or concerns the patient may have. However, during the actual procedure, the nurse's role is to support the surgical team and assist in ensuring patient safety, and not to engage in personal conversations that could blur the lines of professional boundaries. In these moments, maintaining focus on the task at hand is essential. Additionally, physical boundaries in the OR are critical. The perioperative nurse's responsibility is to provide care in a way that respects the patient's personal space and comfort, without engaging in physical contact that is outside the scope of the procedure. This is especially important when it comes to handling the patient, positioning them, or performing assessments, actions that are necessary for the surgery but should be conducted with sensitivity and respect. It's also important to adhere to protocols regarding patient privacy and dignity, even though they are unconscious during the procedure. Ensuring that the patient's body is appropriately covered when not in use during the operation is part of maintaining this respect. The emotional boundaries of the nurse-patient relationship in the perioperative setting are also crucial. Patients are often anxious or fearful before surgery, and while it's important to show empathy and understanding, I always keep the focus on providing professional care rather than becoming emotionally involved. Offering reassurance is a key aspect of my role, but I make sure to do so in a way that keeps the relationship professional and does not cross into a personal realm that might compromise my objectivity or professional ethics. Another important aspect is understanding boundaries in communication. While it is important to communicate effectively with patients to keep them informed, in the perioperative setting, much of the communication with the patient is preoperative or postoperative, as the patient is unconscious or sedated during surgery. Therefore, maintaining appropriate levels of interaction before the procedure, such as explaining the steps and ensuring that the patient understands what to expect, is essential. In the OR, I avoid any personal interactions that could cause discomfort or blur the professional relationship. Additionally, maintaining confidentiality is integral to professional boundaries. I make sure that the patient's medical information is kept private and shared only with those directly involved in the care team, and that sensitive details regarding the surgery or the patient's condition are not discussed outside of the professional setting. In the fast-paced OR, it's easy to become caught up in the work, but it's essential to maintain the patient's privacy at all times, both during and after the procedure. Finally, professional boundaries extend to interactions with other staff members as well. In the OR, it's vital to maintain a respectful and collaborative relationship with all members of the surgical team, while keeping communication professional and task-focused. I always strive to keep the focus on the patient's care and the needs of the surgery rather than allowing interpersonal dynamics to interfere with the work at hand. In summary, my understanding of professional boundaries in the perioperative setting is based on maintaining respect for the patient's dignity, ensuring clear communication, safeguarding privacy, and staying focused on the clinical role while avoiding any actions or behaviors that could compromise the professional relationship. This is essential not only to provide the best possible care for the patient but also to uphold the ethical standards and integrity of the nursing profession.
How do you maintain patient confidentiality and privacy in the OR?
Maintaining patient confidentiality and privacy in the operating room, OR, is of utmost importance, as it ensures the ethical and legal protection of sensitive information while also fostering trust between the patient and the healthcare team. As a nurse in the perioperative setting, I take several measures to uphold patient confidentiality and privacy throughout the surgical process. First, I always ensure that only authorized personnel are present in the OR. This includes verifying the identities of everyone in the room and ensuring that anyone who is not directly involved in the surgery, such as visitors or non-essential staff, is not present. By limiting access to the necessary surgical team members, I help reduce the chances of any sensitive information being overheard or inappropriately shared. Minimizing discussions about the patient is another key way I maintain confidentiality. While in the OR, I avoid discussing any personal or sensitive patient information unless absolutely necessary for the procedure. If I need to share information with a team member, I do so in a way that is relevant to patient care and ensures that any non-essential details are left out. Additionally, if we need to discuss patient history or details, I make sure that the conversation takes place in a professional and private manner, away from the ears of others who are not involved in the direct care of the patient. Patient identification is another critical area where I maintain privacy. Before the surgery begins, I verify the patient's identity, surgical site, and procedure through the process of a surgical timeout. This is a critical safety step, but it also helps ensure that all identifying information is handled securely and correctly. I am careful not to share any identifying details publicly or in a manner that could be overheard, ensuring that the patient's identity is only known to those directly involved in the procedure. When it comes to patient records, I ensure that any personal or medical information is kept strictly confidential. I avoid leaving any physical records out in the open, and I make sure that any digital records are stored securely in the hospital's information system, which should be password protected. I only access and share patient information as necessary for the procedure, and I ensure that all communication within the team is handled with discretion and confidentiality. Additionally, I am very conscious of ensuring the patient's privacy during the procedure. In the OR, maintaining a sterile field and ensuring that the patient's body is appropriately covered when not in use is essential to both patient safety and their privacy. I work with the surgical team to ensure that the patient's modesty is respected at all times and that unnecessary exposure is avoided. I also avoid discussing surgical details or the patient's condition outside of the OR. Any conversation about the procedure or the patient's progress should take place in appropriate settings, such as post-operative rounds or designated team meetings, where patient information can be discussed privately and professionally. I take care not to share any patient-specific details in public spaces or during casual conversations with other staff members, as it could breach confidentiality. Finally, I ensure that I follow hospital policies and protocols regarding patient privacy, including adhering to guidelines set forth by organizations like HIPAA, in the US, or other relevant privacy regulations in the country. These policies are in place to protect patient confidentiality, and I make sure I am always compliant with them by staying informed about best practices in privacy and data protection. In summary, maintaining patient confidentiality and privacy in the OR involves ensuring that only authorized personnel are present, minimizing unnecessary discussions about the patient, safeguarding patient records, maintaining physical privacy, and following hospital policies. By respecting these principles, I ensure that patient information is handled with the highest level of confidentiality, fostering a trusted and secure environment in the OR.
What are your thoughts on continuing education and professional development in perioperative nursing, e.g., CNOR certification?
Additionally, attending conferences and seminars is another important avenue for professional growth. These events allow me to network with other perioperative nurses, share experiences, and learn about the latest advancements in surgical care. Often, these conferences feature experts in the field who present cutting-edge research, which I can then apply in my practice to improve patient outcomes. Exposure to diverse perspectives and innovative ideas helps me stay motivated and engaged in my work. In summary, I view continuing education and professional development as fundamental to my role as a perioperative nurse. Whether it's through certifications like CNOR, attending workshops, or engaging in mentorship and peer learning, these activities help me grow both personally and professionally. By committing to lifelong learning, I am better equipped to meet the challenges of the perioperative environment and provide the highest standard of care for my patients.
Are you familiar with current best practices and guidelines in perioperative nursing?
Yes, I am familiar with current best practices and guidelines in perioperative nursing. These guidelines are essential for ensuring patient safety, promoting optimal surgical outcomes, and maintaining a high standard of care in the operating room, or. As part of my commitment to ongoing professional development, I make it a priority to stay up to date with the latest evidence-based practices, protocols, and standards set by leading organizations in perioperative nursing, such as the Association of Perioperative Registered Nurses, RN, the American Nurses Association, ANA, and other relevant bodies within the healthcare field. One of the key areas I focus on is patient safety. The best practices for patient safety in the perioperative setting are rooted in protocols such as the Universal Protocol for Preventing Wrong Site, Wrong Procedure, and Wrong Person Surgery. This protocol emphasizes patient identification, surgical site verification, and the use of a timeout procedure before the incision is made. These steps are designed to ensure that the correct procedure is performed on the correct patient at the correct site. I am diligent about adhering to these practices, and I also participate in timeout procedures to confirm the details of the surgery with the entire surgical team. In addition, aseptic technique is one of the cornerstones of perioperative care. Maintaining a sterile field is crucial to prevent surgical site infections, SSIs. According to best practices, I ensure that all staff in the OR adhere to strict hand hygiene protocols, use appropriate personal protective equipment, PPE, and follow sterile procedures when handling instruments, medications, and other materials. I am also well versed in surgical instrumentation and how to manage equipment in a way that minimizes the risk of contamination, ensuring that sterilization protocols are rigorously followed. Regarding patient positioning, I am familiar with guidelines that ensure the patient is properly positioned to prevent complications such as nerve injury, pressure ulcers, and musculoskeletal strain. The best practices in patient positioning are based on anatomical considerations, the type of surgery, and the patient's pre-existing conditions. I ensure that I collaborate with the surgical team to position the patient in a way that promotes optimal surgical access while safeguarding the patient's physical well-being. I am also committed to staying informed about anesthesia best practices and how they affect patient care. This includes understanding the different types of anesthesia, general, regional, and local, and their potential risks and benefits. I keep up to date on emerging trends in anesthesia management, such as the use of enhanced recovery after surgery, ERAs, protocols, which aim to reduce complications and promote faster recovery through evidence-based practices like early mobilization, optimized fluid management, and minimizing opioid use. Another area of focus is pain management. Best practices for pain management in the perioperative setting involve using multimodal strategies to manage pain both during and after surgery. This includes the use of local anesthetics, opioids, non-opioid analgesics, and adjunct therapies like nerve blocks or epidural analgesia when appropriate. I follow the guidelines to assess pain continuously, adjust interventions as needed, and collaborate with the anesthesia team to tailor pain management plans to the individual patient's needs. Finally, postoperative care is an area where best practices are crucial for monitoring patients for complications like respiratory distress, bleeding, and nausea and vomiting. Following evidence-based guidelines for postoperative care helps ensure that patients recover safely from surgery and can be transferred to the post-anesthesia care unit, PACU, with minimal risk of adverse outcomes. I also closely follow guidelines for patient education to ensure that patients are informed about their recovery process, including signs of complications and how to care for their surgical site. In summary, I am committed to adhering to the current best practices and guidelines in perioperative nursing, as they form the foundation for high-quality care and patient safety in the OR. By staying informed and up to date on the latest evidence-based practices, I can contribute effectively to the surgical team, support patients through their surgical experience, and enhance outcomes.
During a surgical procedure, the surgeon requests an instrument you are unfamiliar with. What are your steps?
If a surgeon requests an instrument that I am unfamiliar with during a surgical procedure, my first priority is to remain calm and focused on the situation at hand. I understand that in the operating room, maintaining a clear and efficient workflow is essential to patient safety, and I approach such situations with a problem-solving mindset. Initially, I would ask the surgeon for clarification on the instrument's name and its intended use, making sure I fully understand the specific requirements for the task. In case I am still unsure, I would take a moment to quickly assess the surgical instrument tray to locate the instrument based on its appearance and description. If I cannot identify it immediately, I would calmly inform the surgeon that I am not familiar with that specific instrument and request assistance from a colleague, such as a more experienced perioperative nurse or the surgical technologist, who may be able to identify and provide it. Throughout this process, I would ensure that the surgical team remains aware of the situation and that there is no disruption to the procedure. I would keep the lines of communication open and transparent, acknowledging the situation and working with the team to resolve it as quickly as possible. In doing so, I maintain a professional, collaborative approach that prioritizes patient safety and the effective functioning of the team. Once the instrument is located and provided, I would take note of its specific function and ensure I am familiar with it for future reference. After the procedure, I would take the opportunity to review and learn more about the instrument through available resources or by discussing it with colleagues. This experience would serve as an important reminder of the importance of continuous learning and adaptability in the OR. Ultimately, my approach is rooted in a commitment to patient safety, clear communication, and continuous professional development. I recognize that unexpected situations arise in the operating room, and I am always ready to respond with confidence and a focus on finding the best solution for the patient and the surgical team.
A patient expresses significant anxiety just before entering the OR. How would you address their concerns?
If a patient expresses significant anxiety just before entering the OR, my primary goal is to provide reassurance and support while ensuring they feel heard and understood. I recognize that entering the operating room can be a stressful and uncertain experience for patients, and addressing their emotional state is just as important as ensuring their physical well-being. First, I would approach the patient with a calm and empathetic demeanor, acknowledging their feelings and concerns. I would listen actively to what they are expressing, whether it's fear of the procedure, worries about anesthesia, or anxiety about the unknown. I believe that allowing the patient to verbalize their fears can be incredibly relieving for them and helps establish trust. Next, I would provide clear, concise information to address their concerns, without overwhelming them with too much detail. For example, I would explain the steps of the procedure, reassess any questions they may have, and reassure them that they are in good hands. I would emphasize the collaborative nature of the surgical team, reassuring them that everyone involved is highly trained and focused on their safety and well-being. I would also take the time to empathize with the patient and acknowledge the vulnerability they are feeling. For instance, I might say something like, "I understand this is a big step, and it's completely normal to feel anxious. Our team will take great care of you, and we are here to support you every step of the way." This kind of reassurance helps to build rapport and foster a sense of security. If appropriate, I would also offer the patient techniques to manage their anxiety, such as guided breathing exercises or other relaxation techniques, to help them feel more at ease. Sometimes, patients find comfort in simply knowing that their nurse is there to support them, so I would ensure that they feel accompanied and not alone in the process. In cases where anxiety is particularly high or if the patient has specific fears, I would communicate with the anesthesia team or the surgeon to explore any options for additional support, such as preoperative sedation or other calming measures, to ensure the patient's comfort before the procedure begins. Finally, I would stay with the patient as much as possible, offering reassurance and maintaining a calm, compassionate presence until they are fully prepared to proceed to the OR. If there are any changes in their emotional state or if they express any further concerns, I would continue to address those and update the surgical team accordingly. Ultimately, my approach would center on providing emotional support, offering clear information, and ensuring that the patient feels heard and cared for. In doing so, I help alleviate their anxiety and set the stage for a smoother surgical experience.
There is a discrepancy in the surgical count. What is your immediate course of action?
If there is a discrepancy in the surgical count, my immediate course of action would be to stay calm and focused, as ensuring patient safety is the priority in these situations. The first thing I would do is immediately communicate the issue to the rest of the surgical team. I would calmly inform the team that there is a discrepancy in the count, and I would pause the procedure until the issue is resolved, as it is critical to address it before proceeding further. Next, I would double-check the instruments and sponges in the sterile field, as well as the surgical drapes, ensuring that no items have been accidentally missed or hidden. This involves a systematic and thorough search to verify that nothing has been left behind or misplaced during the procedure. I would also make sure that all instruments and supplies used during the surgery are accounted for. I would then review the original count with the rest of the team to verify if there were any errors in the initial count or if something was added or removed during the procedure that was not properly documented. If the discrepancy involves surgical instruments or other items that are not visible in the sterile field, I would assist in a more thorough search, including checking the patient's surgical site and any areas where items could have been misplaced. If the discrepancy persists and no items can be found, I would escalate the situation to the surgeon and the surgical team leader. This would involve a more comprehensive search of the entire operating room, including looking in all drawers, sterile wraps, and equipment that may have been used during the procedure. It's essential to ensure that no items are missing before the surgery is concluded, as this could pose a serious risk to the patient. At no point would I rush through this process, as the importance of patient safety outweighs any sense of urgency to complete the procedure. If after the search the discrepancy remains unresolved, I would discuss with the team the possibility of X-ray imaging or any other procedure that could assist in locating a missing item, depending on the circumstances and hospital protocols. Once the count discrepancy is resolved, I would document the situation thoroughly, detailing the actions taken, the results of the search, and any actions agreed upon by the surgical team. This documentation ensures that all steps were taken to safeguard patient safety and allows for accountability within the OR team. Throughout this process, I would maintain clear communication with the team and with the patient, ensuring that everyone is aware of the situation and that patient safety remains the top priority.
A piece of sterile equipment is accidentally contaminated. How do you handle this situation?
If a piece of sterile equipment is accidentally contaminated, my primary responsibility is to ensure that the integrity of the sterile field is maintained and that patient safety is not compromised. The first step I would take is to immediately notify the surgical team of the contamination, so that we can assess the situation collectively and make a plan for how to proceed. The next immediate action would be to remove the contaminated equipment from the sterile field and replace it with a new, sterile piece of equipment. I would ensure that any equipment or instruments that have been compromised are disposed of properly, following the hospital's protocols for handling contaminated items. It's essential that I do not try to re-sterilize the equipment in the OR because re-sterilization could compromise the process, and the equipment must remain sterile for the procedure. At this point, I would also recheck the sterile field to ensure that no other items have been inadvertently contaminated. This includes checking the sterile drapes, instruments, and any other items in use. If necessary, I would assist in re-establishing the sterile field by having a team member assist in replacing any items that may have been contaminated and ensuring that everything in the field is properly organized. Once I've taken these immediate corrective actions, I would work with the surgical team to review the situation and ensure that we all understand how the contamination occurred to avoid similar situations in the future. If necessary, we would review hospital policies regarding sterile technique and ensure that everyone is adhering to the same standards and protocols. Finally, I would document the incident in accordance with hospital policies, providing a clear record of the contamination, how it was handled, and any steps taken to ensure the patient's safety. Documentation is crucial for both quality improvement purposes and for accountability. Throughout the process, I would remain calm, focused, and solution-oriented. The goal is to address the situation quickly, maintain the safety of the patient, and ensure that no further complications arise from the contamination. By maintaining clear communication with the team and adhering to strict protocols, I would ensure that the surgical procedure can continue with minimal disruption and risk to the patient.